esteemed delegates and the guests to participate in this symbolic event. By Dr. Korala Pragnya.
महागणपतिं मनसा स्मरामि 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 वसिष्ठवामदेवादिवन्दितमहागणपतिं महादेवसुतं महादेवसुतं गुरुगुहनुतं महादेवसुतं गुरुगुहनुतं मारकोटि प्रकाशं शान्तम्.
We would like to present a video made by our students which shows the importance of homeopathy in day-to-day life.
ఇప్పుడే నా కౌన్సిలింగ్ అయింది. ఎంబీబీఎస్ లో సీట్ వచ్చింది.
వావ్, కంగ్రాచులేషన్స్ రందీప్, ఎంత హ్యాపీ న్యూస్ చెప్పావు.
ఇంతకీ నీ కౌన్సిలింగ్ ఎప్పుడు? సర్టిఫికేట్ వెరిఫికేషన్ అయిందా లేదా?
నెక్స్ట్ మండే ఉందిరా, కొంచెం టెన్షన్ గా ఉంది.
ఏం కాదు, టెన్షన్ పడకు, నీకు కూడా మంచి స్కోరే ఉందిగా, ఖచ్చితంగా సీట్ వస్తుంది. ఆల్ ది బెస్ట్.
థ్యాంక్ యూ రందీప్.
నీ కాల్ కోసమే చూస్తున్నా.
హాయ్ రందీప్, కొంచెంలో ఎంబీబీఎస్ సీట్, అది కూడా రిజర్వేషన్.
ఒకే రూమ్ లో ఉండి చదువుకుందాం. See you soon, bro. ఫస్ట్ డే ఎలా ఉంది?
ఏమంత ఇంట్రెస్టింగ్గా లేదు బ్రో. జస్ట్ బుక్స్ ఇచ్చారు, యాప్రాన్ ఇచ్చారు, మా సీనియర్స్ ఇంట్రొడక్షన్ అయింది అంతే.
సేమ్ ఇయర్. అసలు ఎంత పెద్ద కాలేజ్ రా, చాలా బాగుంది.
మా కాలేజ్ అంత పెద్దగా ఏం లేదు కానీ ల్యాబ్స్, ఇన్ఫ్రాస్ట్రక్చర్ అన్నీ బాగున్నాయి. మాకు డిసెక్షన్ హాల్ కూడా ఉంది విత్ కెడవర్స్.
అవునా, గుడ్. హే, నా మెడికల్ బుక్స్ చూడు సంజు.
హే, నావి సేమ్ బుక్స్ బ్రో, ఇదిగో.
ఓ, అయితే మనం సేమ్ బుక్స్ చదువుతాం అన్నమాట. అయినా కానీ ఎంబీబీఎస్ఏ కష్టం, నేనే ఎక్కువ కష్టపడాలి. హలో. అవునా, ఇప్పుడు ఎలా ఉంది అమ్మకి? తనకు ఆస్తమా ఉంది. ఎప్పటి నుండో ఇన్హేలర్స్, టాబ్లెట్స్ అన్నీ వాడుతున్నారు. అయినా కానీ అప్పుడప్పుడు సడన్గా ఆయాసం వస్తుంది. ఈసారి కొంచెం ఎక్కువ సీరియస్ అంట. నిన్న నైట్ హాస్పిటల్లో అడ్మిట్ చేశారంట. నేను అర్జెంటుగా వెళ్ళాలి.
ఏం కాదు, తగ్గిపోతుంది. యూ వాంట్ మీ టు హెల్ప్ యూ?
వద్దులే, నేను చూసుకుంటా. నువ్వు పోస్టింగ్స్ అటెండ్ అవ్వు.
Let's catch up sometime soon.
హలో సంజు, బాగున్నావా? ఆఫ్టర్ లాంగ్ గ్యాప్.
హలో, ఐఎమ్ ఫైన్. హౌ ఆర్ యూ? ఎలా ఉంది మీ మమ్మీ హెల్త్?
నేను బాగానే ఉన్నాను రా. అమ్మ హెల్త్ గురించి టెన్షన్గా ఉంది. ఆస్తమా రోజు రోజుకి ఎక్కువ అవుతుంది. ఎంతమందికి చూపించినా సెట్ అవ్వట్లేదు. ఏం చేయాలో అర్థం కావట్లేదు బ్రో.
రందీప్, నాకు ఒక్క ఛాన్స్ ఇవ్వు. హోమియోపతి విల్ హెల్ప్ హర్. నేను ఇలాంటి కేసెస్లో చాలా చూసా రిజల్ట్స్.
హోమియోపతి?
అఫ్ కోర్స్, వై నాట్?
ఆర్ యూ కిడ్డింగ్? ఎందరో స్పెషలిస్టులు, లేటెస్ట్ ఎక్విప్మెంట్లు ఏం చేయలేకపోయాయి. మీ స్వీట్ పిల్స్ ఏం చేయగలవు? అయినా ఇన్ కేస్ పనిచేసినా చాలా స్లోగా అవుతాయి. మా అమ్మని ఇంకా సఫర్ చేయడం నాకు ఇష్టం లేదు బ్రో.
బ్రో, నేను మీకు ముందే చెప్పా, నీకు హోమియోపతి అర్థం అవ్వాలంటే నువ్వు హోమియోపతిని చదవాలి. కానీ ఒక పేషెంట్కి రిలీఫ్ అనేదే ఇంపార్టెంట్. హోమియోపతికి కొన్ని ప్రిన్సిపల్స్ ఉంటాయి. ఆ ప్రిన్సిపల్స్తో చాలామంది పేషెంట్ని క్యూర్ చేశాం. ఇది 200 ఏళ్ళ నుండి ఉంది. హోమియోపతిలో చాలామంది పైనర్స్ ఉన్నారు. ప్రాక్టీషనర్స్ని రిజిస్టర్ చేయడానికి ఒక సెంట్రల్ కౌన్సిలే ఉంది. WHO మా సిస్టమ్ని ఆల్టర్నేటివ్ సిస్టమ్ ఆఫ్ మెడిసిన్గా గుర్తించింది. అంతేకాక మాకు సెపరేట్ ఆయుష్ మినిస్ట్రీ ఉంది. రీసెర్చ్ సేఫ్టీ, మెడిసిన్ ప్రిపరేషన్, క్వాలిటీ, సేఫ్ డిస్పెన్సింగ్ని చూసుకోవడానికి. దాన్నే మేము NCH అంటాం. నీకు అష్యూరెన్స్ ఇస్తున్నా బ్రో, నో సైడ్ ఎఫెక్ట్స్. ఈ మెడిసిన్ తను రోజు వాడే మెడిసిన్తో వాడుకోవచ్చు.
ఓకే బ్రో, నీ ఇష్టం. నీకు టైం ఉన్నప్పుడు వచ్చి చూడు. అది హోమియోపతియే కానీ వేరే ఏ సిస్టమ్ అయినా కానీ. ఆఫ్టర్ ఆల్ మా అమ్మకి తొందరగా తగ్గడం ఇంపార్టెంట్.
సరే, రేపు కలుద్దాం.
హాయ్ సంజు.
Hi, take your seat.
థ్యాంక్ యూ సో మచ్ బ్రో. అమ్మకి ఇప్పుడు చాలా బెటర్గా ఉంది, మొత్తం నయమైపోయింది. థ్యాంక్ యూ. ఐఎమ్ సారీ, నేను హోమియోపతిని ఎప్పుడు తక్కువ.
I welcome Dr. Nuru Seher Khan ma'am, MD Homeopathy, Principal of Hamsa Homeopathic Medical College. Dr. K.L. Babu, Government Homeopathic Medical College, Kozhikode. Dr. Mallikarjun sir from Naturopathy Homeopathic Medical College. I invite President Dr. Abhijit K. Dam, President of NAPCAM, on the stage. Dr. Nuru Seher.
And dear students from all over the state, a very good morning to one and all. It's a great pleasure and it's a privilege for me and deep sense of responsibility that I stand before you as a principal of Hamsa Homeopathy Medical College, Hospital and Research Center. I request everyone to give a big round of
COVID, yes, definitely is one of the recent. He has an extensive knowledge about the integrating the systems, and he will also be our guide and our. We will meet definitely Madam as the AYUSH director, so we can definitely bring something. When each of us join hands with our own experience, that will become a huge success.
And Dr. Linge Gowda, who's the Vice President of Kerala, is doing wonderful work in palliative care, stream of diseases and some musculoskeletal disorders. They have physiotherapy and stuff. Similarly, in Ayurveda, you have a lot of medicines which help with the massage. Has its advantages in being the best, and the systems of medicine, who also treat stream of for homeopathy and alternative systems of medicine, that we have such good infrastructure, because like many of us know, in society sometimes alternative systems of medicine are probably looked down upon, but I am one of those persons who will champion the cause of all systems of medicine. And I have a voice problem, I have a cold, so I think and I'm really happy from the government colleges here. So I wish a passive thing where you just listen.
Dr. Naturopathic College, Gandhi Naturopathic College, to care. As rightly said by our director, calculating from the top to the down, the government, whatever the colleges, the government of India is proposing in establish is known for gentle medicine. More gentle is particular can do wonders in palliative care. As I said,
Words.
Students who I call on the stage, and they did all the. So a small token of.
Director Department of AYUSH. Would like to
That's why to explore the use of alternative medical systems in palliative care, which can make it cost effective, besides improving the quality of life, not only in the terminally ill patients, but also in the humanity as a whole. I shall give more explanation to that, promote AYUSH. And as a standard form of, and after so radiotherapy and give, and all these can be managed by role of and study number cancer and result in manage. That 100 pains rate. So wonders in palliative. And finally, this is the condition. And this.
Sriraj to present the memento to our speaker, Dr. Thank you, sir. Thank you. Thank you, sir. Thank you, ma'am.
In its proactive, I invite the speaker. Sir, physician, course on sensitive diet. Hospital and Medical College, Homeopathic Medical College, in HIMSS Homeopathic Medical College and Hospital, from College, in HIMSS Homeopathic Medical College and Hospital, from February 2030. He's also an lecturer. He's also a lecturer and clinical. He's a lecturer and medical officer, Departments of Pediatrics, and houseman and RMO and a registrar, Department of Pediatrics. Memorial Homeopathic Institute, Memorial Homeopathic Institute, Deepak Shah in Bangalore during April 2002. DBHP Sabhas, Kulamarva Jai, DBHP Sabhas, Kulamarva Jai. He's a content provider to and Verma. His master degrees in traditional in yoga and naturopathy from the Kasturiba Medical and Research, Manipal Academy of High, the principal in the first division from the next call upon Dr. Saujanya Garu. On to the dais, please. I call Dr. Linga Gowda Garu. He is the chairperson for this session. He is the Vice Chancellor in Sri Siddha Academy of Higher Education, Agalakote, and ex-professor and head of palliative medicine and the SAR Country Award in Karnataka. I would like to Medical Superintendent PG Guide Professor, HOD Department of Homeopathic Pharmacy, and our moderator for this session.
Sparsh Hospice, sections of society. Without any, we ensure to a peaceful demise. Life and afterlife full demise. Life and afterlife, an open spaces, enabling patient grit to absorb the answers, enabling patient grit to absorb the and home-based care, Sparsh Hospice of our this 82-bed facility, a fully and a dining room, activities catering to different needs, green landscapes, AV room for entertainment and trading. Thus, started home care. Sparsh provides tailor-made services catering to the needs and desires of our patient members. All these services are absolutely free of cost for anyone coming to us. This includes the medicines, food, medical and nursing services, and all the other services at Sparsh. We believe that a dignified death is the right of every human being, and we, as a society, should enable this right to be enjoyed. We have created this relaxing world at no expense to the patients, but we are always keen to multiply our helping hand to many more citizens. With your charitable contributions, we can make a big difference. Send your support and make lives matter.
one eminent personality, Dr. Shah. Those are going to present in the afternoon. 5 minutes? Okay, thank you. I just go with the slides. Next. So this is one case scenario. General డాక్టర్స్ అందరు కూడా ఇంకా ఏం చేస్తాం, వాళ్ళకి ఎలా హెల్ప్ చేయగలుగుతాం అనేది. దిస్ ఇస్ ద తనకు లంగ్ క్యాన్సర్తో సఫర్ అవుతుంది, తగ్గించడానికి మనం ఏం చేయాలి. యాజ్ ఎ డాక్టర్గా మన పాటు ఎమోషనల్ సఫరింగ్ కూడా ఉంటుంది. దాన్ని ఎలా అవుతారు, వాళ్ళకి ఏం మాట్లాడాలనిపించదు, చెప్పాలనిపించదు, ఇంకా చావే శరణ్యం అనిపిస్తూ ఉంటుంది. వాళ్ళతో ఎలా వాళ్ళ యొక్క బాధని మనం వినిపించుకోవాలి, ఎలా వాళ్ళకి హెల్ప్ చేయాలనేది. నెక్స్ట్. ఆ విధంగా అవ్వచ్చు. నెక్స్ట్. సో మార్ఫిన్, మెథడాన్. సో నెక్స్ట్. సో జనరల్గా ఇవి వచ్చినప్పుడు కూడా నాజియా, వామ్, ఇవి కాకుండా సరదాగా ఆడుతూ పాడుతూ ఉంటే వాటి నొప్పి తగ్గినట్టు అనిపిస్తూ ఉంటుంది. అఫ్ కోర్స్ పేషెంట్.
I request, having worked in palliative care for me, state, to all of you, each one of you, Jorse, because you will not get this chance once again. You will not get this chance once again. When we go to developed countries, in fact, they make them to hug, they make them to kiss. Of course, our culture doesn't permit. For students, if you like, you can kiss some of your friends. No problem. You can take few seconds and sit down. This is because continuously listening. In fact, all these things I learned from Dr. Robert Wycross and Gilliburn, who was the people who brought palliative care to India 3 decades, 4 decades back. And dear friends, one thing I'll understand you, I am not here to say about the drugs and other things. As Dr. Dham said, death is after detecting with cancer, she died that they should die with dignity. In fact, most of when my turn comes out an IV line, we don't need any IV line or oxygen, we just need a compassionate touch. That's most important. Thank you, moderator.
Very good afternoon to all the dignitaries, chairperson, moderators. Palliative care is what? Palliative care. Not only from the doctors, but also a lot of care and the individually, and so that they lead a dignified life and have a dignified death. So, talking about this type of pain which the patients suffer and the intensity of the pain which the patients suffer and what they can do. Okay, so this patient was a patient of a headache. When I was talking to the patient's son was accompanying, and he described that whenever the patient has severe pain, she takes a rope, ties it across, doing this. So when I was looking at her, this is the expression which I had on my face, that is she gone mad? Right? Which person can kill herself just because of a pain? Okay? What we came to a Homeopathic Medical, right? Because left knee pain aggravates happen on the tissues. And believe me, he came down to see how is this medicine slides. For a period, he was not going to the case in detail, and we added a deep acting remedy. He was not going to the case in detail, and we added a deep acting remedy. Helped him to given a chance at some other, able to help take home lessons from this approach to getting the treatment, understanding the pathos, developed the holistic.
Within a minute about what is Ayurveda. Pain shula. What you use in Shula. So that is what we have to cover Rasa Aushadas. You have to reduce the, so for example, sir, when you are having a gastritis, to use medicines like Trikatu, the more of ghee, Shirabala, so to identify the.
So that unit we will, and if the mother treatment be knowing about Verma therapy, I will tell in the next session about that. So in Ayurveda they say Marma Chikicha. So in Siddha it is very practically we are using Verma therapy. Normal we have to use Ayurveda. If you mix and you can apply on the tongue, the nausea vomiting will be stopped. So this is how we treat in the nausea. So in Unani you have Sarbat. Like that in Siddha, Manapagu is a syrup. We have traditional syrup. And the cardamom seed based Eladi Churnam. It is also only, sir. Yeah, it is also good for the vomiting. Then constipation, this is also in this session. So we use same terminalia, chabula, senna based medicines. Then castor oil alone should not be given, should be combined with the honey and the ginger juice. Equal quantity. If the right nostril is blocked, nasal septal deviation, or kapha, or sinusitis, they will be constipated. Just a simple thing, you make them to sleep on left, make the right nostril to flow, constipation is relieved. So this is how, so many things actually we can practice from our traditional. And do what the benefit you get through yoga practice, same thing can be given by Verma, because both are actually manipulating our Verma points. Their patient can't perform any asana. On behalf of them, you can manipulate few points. Yoga can be performed. You know, these all next session we will talk with the other topics. Thank you.
Thank you, sir. Next, I would like to invite Dr. Mallikarjun, Naturopathy. Dr. Mallikarjun, sir, Naturopathy.
Yeah.
I take the opportunity to congratulate the Hamsa Homeo Medical College and the other medical colleges who are participating in this seminar, because it is the need of the hour. Now, palliative care, everyone thinks the fag end of the life, when they are about to die, then we are supposed to give some relief to them. So it's not like that. Palliative care is the care which should be started as early as possible when we know that they have some debilitating disorder which cannot be cured, so that we can prevent complications and increase the quality of life. So I think, we have started. I take this opportunity to create some awareness regarding our naturopathy and yoga, because I am representing a medical college, Gandhi Naturopathic Medical College, who are the pioneers in the system of naturopathy and yoga education. This college has started in 1969. So after that, many of the colleges in India, approximately now more than 70 colleges are there in India who have taken us as a role model. So because there are a lot of apprehensions regarding naturopathy, they assume that, some people assume that whenever the patient comes, we put them on a fasting or something like that. No, it is not like that. It is very scientific. Under supervision we do it. So I take the opportunity to enlighten about our system also. Apart from that, naturopathy is 99.9% palliative care, because many of the patients who come to us, they come with a lot of reports by exhausting all the remedies. So last resort they come to us. So they come with a bundle of investigation reports, and you can say, for example, if I take a rheumatoid arthritis case, you can see the Botner and Swan-neck deformity, which usually deformity, they have restricted spine, their movements are restricted. So I take the opportunity to just So I'll quickly run through the slides because we have only 5 minutes time. So it is not new system, it is an ancient system. So I just like to, as a mark of respect, tell the founders, Dr. B. Vijayalakshmi Garu and Venkatrao Garu, the founders of this hospital, which is in Amirpet, and it was established in 1949. So palliative care, everyone knows that there is a spiritual dimension in palliative care, which we do not find in WHO definition. Vomiting. So unless we give a bland diet and a soothing diet, because we classify the diet as soothing, eliminative and constructive diet, soothing diet, it will not subside. So diet plays a major role in any of the disorders, not only nausea, vomiting, any of the disorders, even in constipation also diet plays a vital role. So this is the way we give the classification of the diet. So fasting therapy is not for all. It is a kind of therapy which we go for autophagy, which one of the scientists has got a Nobel Prize. So where we say that the autophagy concept detoxifies the body. So it is not for everyone, especially when a person comes with diabetes or an elderly person. We don't put them on fasting. There are certain indications which we do it scientifically under monitoring. So this is one of the major therapies, hydrotherapy, where we have a lot of packs, hot and cold packs to give relief. Like if we have dyspnea, we have a modality of treatment which is called chest pack, which immediately gives relief. Like any person with having dyspnea, especially in COPD cases. So we have a wonderful relief, spontaneously we get relief. So many of things are naturopathy, we have to stay for 1 month, 2 months, 3 months, then only we get relief. No, it's not like that. We can give spontaneous relief also because we have a lot of therapeutic modalities, physical therapies. Like one is hydrotherapy. For example, I have told that chest pack. So we have mud therapy for skin disorders. We have massage therapy for pain management. Because everyone knows we are all from medical background. We have a pain gate pathway, which in 1965 Meljack and Wall have proposed this pain gate pathway, which specifically says that the pain perception is taken to the brain by the free nerve endings, nociceptive nerve endings, right? A delta fibers and C fibers. So we have to benumb that. For that, direct manipulation of that part, because you all know when you get an injured, you just rub it. That is also a therapy. Because if you rub it, your nociceptive nerve endings become benumbed. Like that, we have physical therapies, a lot of physical therapies which can benumb it, like giving a small fomentation or a cold pack or a cryotherapy, that is use of ice, will benumb that pain's perception, spontaneously that is. Because if you give medicine, it may take half an hour or 45 minutes or 1 hour, or sometimes you have to give a course of medicine, but these therapies are spontaneous. So we have one sun bath, especially for skin disorders, for detox, reflexology. And we have physiotherapy also. We use a lot of electrotherapy techniques like IF, interferon therapy, TENS. Again, the concept of these treatments are pain modulation. So now coming to one of the most important now, yoga has become like a hot cake now because 175 countries do follow yoga now, International Yoga Day, courtesy to our Government of India, IS department. But what we do in yoga, everyone thinks that yoga means we make the patient lie down on the ground and then go for yoga, and for that patient has to be fit. No, it is not like that. Yoga therapy can be taken at any point of time. Like I said, palliative care, one example I would like to give. I was associated with one research project in Medwin for a cancer-based research project where we have given some relaxation techniques to the terminally ill cases for the cancer patients. And we have seen that quality of life was evaluated by a neuropsychiatrist. So there was a lot of improvement in their pain perceptions. And there many of the patients we lost because of the terminal case, we lost the patients, but there was no pain. So we were surprised to see that. So yoga therapy can be given because yoga means everyone thinks that some asanas are there, physical postures are. No, it is not like that. Even simple breathing exercise, pranayama, regulation of pranayama will also do good. And relaxation techniques, we have a lot of techniques like instant relaxation technique, deep relaxation technique. We have yoga nidra, we call it part by part relaxation techniques for stress management. And as we all know, stress is now one of the factors for many of the autoimmune disorders also. So everyone thinks yoga means the 8 limb Patanjali Yoga Sutras, right? So it is a traditional, it is religious. No, it is not. So what we have done is you have taken yoga as a therapeutic tool. So everyone can practice it. In our institute, we have a beautiful yoga halls. Around 3 yoga halls are there. Around 600 people do come for yoga in our institute. And whatever case it is, when it is admitted in our hospital, we teach them yoga therapy.
Sir, 2 more minutes only.
Yeah, I'll conclude. So we are using asanas, pranayama, and some relaxation techniques. Along with that, mudras, we have a lot of things like bandhas, we have shatkriyas, detoxifying mechanisms, which will help in giving some relief and then improve the quality of life. Because many of the cases who are coming to our institute are terminally ill, who have taken all the treatment from all modalities, then they cannot get relief, then they come to us. So the primary focus of our naturopathy is, these are some slides I just wanted to share because lack of time I am not able to, scientifically I wanted to explain what is naturopathy actually. So these are the disorders which we treat usually. And we do take terminally ill cases like cancer, we take rheumatoid arthritis, we take ankylosing spondylitis cases also, which are do not have any treatment as on today. So blend of naturopathy and yoga with other system of medicine will be very useful treating and improving public health. It will be a great boon because wellness centers in Nizam System Medical Sciences, initially there was opposition, but now we can say because ours is a autonomous institution, we charge. So we are almost, getting an income of around 3 to 5 lakhs per month in NIMS. You can just imagine the demand what we have in NIMS. We have a beautiful wellness center where we have integrated the naturopathy, yoga and Ayurveda Panchakarmas there. So apart from that, we have one more wellness center in JSPS Homeopathy Medical College also, where we have appointed our yoga instructors for especially pain management, and they're doing some simple physical therapy for pain management also. So integration of this, there is a huge demand it seems. So integration of naturopathy and yoga therapy specifically will definitely help in alleviating the suffering of the humanity. So we can integrate with any system of medicine because these are physical therapies. We don't give any medicines in naturopathy. Naturopathy is a drugless system. It only gives physical therapies, but their spontaneous relief is there. So integration of any system, because if as one of the speakers was telling, we can give homeopathy medicine along with allopathy with a gap, right? So, but here there is no requirement of any gaps because they're physical therapy. There is no interaction as such. So it can go with allopathy, it can go with homeopathy, it can go with Unani, you can go with Siddha, Ayurveda, every system it can integrate. But once we integrate, this holistic approach will give lot of relief to the suffering of the humanity because they come with a lot of pain. The patients are sadhaka, we call it sadhaka, we don't call them patients also because we teach some techniques which they can follow at home also. So we call them sadhakas. Whoever joins in our hospital, we call them sadhakas because they learn these techniques and they can practice at home. So whatever stage it is, you can say more or less all naturopathy hospitals are like hospice. So they're all suffering with past 20 years, some are suffering with past 30 years. So we give a lot of comfort to them. We have outpatient facility as well as inpatient facility. So I request everyone to have a visit to our hospital. And I thank once again Hamsa for giving me the opportunity to share what is our system with you people. But I would like to clear, I'll take just half a minute, sir. Some apprehensions like we give them fasting therapy, లేకపోతే తెలుగులో చెప్తాను ఏదో రాగానే మాడబెడతారు. It's not correct. We give them full diet. We give them according to their case. We plan the diet like rheumatoid arthritis case. We assume diet is a major factor. So we stop animal protein to them. We give a lot of vegetables and fruits which have antioxidants. which remove free radicals. So we have to remove the oxidative stress. So free radical removal. So like that we plan scientifically, under monitoring they do. So they have a lot of relief. 99% cases we don't have any failure. But we do have some cases which do not respond because the onset of the disease is such that become so chronic that they may not get some relief. But definitely there is quality of improvement. There is a quality of improvement, a quality of life improvement in those cases. So with this, I once again thank the organizers for giving me an opportunity to share my thoughts and tell about my institution. Thank you very much.
Thank you, sir. Thank you for valuable insight.
Thank you very much, sir. Next, I would like to invite Dr. Saujanya Garu, Unani.
One of the sister kada vomitings and nausea, delirium. దీనికి మన యునాని ట్రీట్మెంట్లో ది బెస్ట్ అంటే ది బెస్ట్ ట్రీట్మెంట్ యునానీలో కూడా ఉన్నాయి. సో యాక్చువల్గా ఏంటంటే నేను కొద్ది టెన్షన్ అవుతుంది సార్. యాక్చువల్లీ యునానీ నుంచి ఫస్ట్ ఆఫ్ ఆల్ నేను ఇంట్రడ్యూసింగ్ అనేది ఎక్కడ చేయలేదు. సో చాలామందికి యునానీ అనేది తెలియదు. యునానీ ఏంటి అంటే అరబిక్ అండ్ పర్షియన్ లాంగ్వేజ్ నుంచి వచ్చిన ఇంట్రడ్యూస్ అండ్ ఇన్ ట్రెడిషనల్ మెడిసిన్. ఇది వచ్చేసి క్రానిక్ డిసీజెస్కి ట్రీట్మెంట్స్ చాలా బాగుంటాయి. అండ్ ఇంకొకటి ఏంటంటే ఆర్థరైటిస్, పెయిన్ రిలీఫ్, క్రానిక్ డిసీజెస్కి చాలా బెస్ట్ ట్రీట్మెంట్. యాక్చువల్గా అందరు సార్ వాళ్ళు బ్రీఫ్ ఎక్స్ప్లెనేషన్ ఇచ్చారు. సో నేను అంత లెంతీగా ఇవ్వలేను, బట్ నేను స్వీట్ అండ్ షార్ట్గా చెప్పేస్తా. యాక్చువల్గా మా ట్రీట్మెంట్స్లో సుఫూఫ్ అండ్ మాజూన్, హబ్, కుర్స్ ఇలా ట్రీట్మెంట్స్ ఉంటాయి. దీంట్లో మెయిన్ ఆఫ్ ది పార్ట్ హమామ్స్ అంటే ఆయిల్స్ తోటి బాతింగ్ ఉంటుందన్నమాట పెయిన్ రిలీఫ్కి. మ్యాక్సిమం పైల్స్ రిలీఫ్ పెయిన్కి హమామ్స్ యూజ్ చేయడం అండ్ ఆర్థరైటిస్కి ఆయిల్స్ యూజ్ చేయడం. రోగనే బాదాం, రోజనే సుర్క్, సుఫూఫే బాదాం, ఉస్తుకుద్దుస్. మెయిన్గా ఉస్తుకుద్దుస్ వామిటింగ్ అండ్ నజియా, డెలీరియం అంటే ఏంటి? వన్ టైప్ ఆఫ్ కాన్స్టిపేషన్లో వచ్చే వన్ టైప్ ఆఫ్ మతిమరుపు. కాన్స్టిపేషన్ నుంచి వెళ్ళి మతిమరుపు కూడా వస్తుందని చాలా మటుకు ఎవరికి తెలీదు. సో ఇది వన్ టైప్ ఆఫ్ మలబద్ధకంతో కూడిన మతిమరుపు అనమాట. ఏంటి డెలీరియం అనేది? అంటే కాన్స్టిపేషన్ వచ్చేసినా కూడా వామిటింగ్స్ వస్తాయి. సో దానికి కూడా ఏంటి త్రిఫలే ఉస్తుకుద్దుస్, తామరిండ్, త్రిఫలే తామరిన్, సుఫూఫే ఖద్దూస్ ఇలాంటివి ప్రొవైడ్ చేస్తామన్నమాట. యాక్చువల్గా యునానీలో మెయిన్ బేసింగ్ ఏంటంటే అందరికీ అర్థం అవ్వదని నేను బ్రీఫ్ ఎక్స్ప్లెనేషన్ ఇవ్వట్లేదు, తెలుగులోనే చెప్తున్నాను. ఇందాక సార్ చెప్పారు కదా న్యాచురోపతి సార్, డాక్టర్ ఏజ్డ్ తోటి ప్రిపరేషన్ ఆఫ్ యునానీ మెడిసిన్ అనమాట. ఇందులో ఇంకొకటి ఏంటంటే మెయిన్గా మనకి 7 కాంపోనెంట్స్ తోటి డిపెండ్ అవుతుంది మెడిసిన్స్. యాక్చువల్లీ ఏంటి అంటే అర్ఖాన్, మిజాజ్, అఖ్లాత్, అజా, అఫాల్ అండ్ అర్వా. దీన్ని బేస్డ్ తోటే ఒక పేషెంట్ని రిసీవ్ చేసుకుంటామన్నమాట. పేషెంట్ ఎలా ఉన్నాడు దాన్ని బట్టి మేము అతనికి ఏ విధంగా ఇస్తే సూటబుల్ ట్రీట్మెంట్ సెట్ అవుతుంది. పెయిన్ కిల్లర్తో పెయిన్ ఆర్థరైటిస్ అతనికి ఏ విధంగా ట్రీట్ చేయాలి? సుఫూఫ్లో ఇస్తాము, కుర్స్లో ఇస్తాము. అండ్ ధలక్ మెయిన్ ఇంపార్టెంట్ యునానీ మెడిసిన్లో ధలక్ థియరీ ఈజ్ వెరీ ఇంపార్టెంట్ అండ్ డైటోథెరపీ ఇంపార్టెంట్. అండ్ ఇంకొకటి ఇందులో పార్ట్ ఆఫ్ ద కప్పింగ్ థెరపీ ఇందాక న్యాచురోపతిలో కూడా చూపించారు. కప్పింగ్ థెరపీ కూడా యూజ్ చేస్తాం. డిపార్ట్మెంట్ అనేది వేరువేరుగా ఉన్నా అందరివి రిలేటెడ్గా ఉండడంలో కొంచెం లిటిల్ బిట్ వేరియేషన్ ఏంటి అంటే ఎక్స్ప్లెనేషన్ ఒకటే వేరియేషన్ ఉంటుంది, మెడిసిన్ ఒకటి వేరియేషన్. మ్యాక్సిమం అందరూ రిలేటెడ్గానే ఆయుష్ డిపార్ట్మెంట్లో ఉండే ప్రతి ఒక్క ట్రీట్మెంట్ నియర్గానే ఉంటుంది. బట్ పలకడం, ఉచ్చరించడం ఒకటే డిఫరెన్సెస్ ఉంటుంది. యునానీ అనేది మ్యాక్సిమం 100లో 80% మెంబర్స్కి యునానీ డిపార్ట్మెంట్ గురించి తెలియదు. యాక్చువల్గా యునానీ వచ్చింది ఏంటి? అరబిక్ అండ్ ఉర్దూ కంపల్సరీ ఉండాలి, ఉర్దూ అండ్ అరబిక్. దాంతో మనకి లిటరేచర్ ఉంటుంది, కంప్లీట్ పర్షియన్ లాంగ్వేజ్ ఉంటుంది. ఇందులో వచ్చేసి ప్రిన్సిపల్ ఆఫ్ యునాని ఏంటి అంటే ట్రీట్మెంట్ అంతా ట్రెడిషనల్గా ఉంటుంది, న్యాచురల్ ఉంటుంది. క్రానిక్ డిసీజెస్కి మాత్రం యునానీలో ది బెస్ట్ మెడిసిన్స్ ఇత్రిఫలే హుస్తుకుద్దిస్. ప్రతి ఒక్కరికి ఇవ్వాల్సిన అస్గంధ్ అనేది పార్ట్ ఆఫ్ ద మెడిసిన్ అనమాట. అస్గంధ్ ఇది మన బాడీలో ఉన్న ఎలిమెంట్స్ కూడా వన్ ఆఫ్ ద పార్ట్ ఆఫ్ బైల్, బ్లాక్ బైల్, ఏమంటారు మా లాంగ్వేజ్లో చెప్పాలి, బల్గం, సఫరా, సౌదా అని ఈ 4 బేస్డ్ తోటే పేషెంట్ని హాట్ అండ్ కోల్డ్ ఇలా బేస్ చేసుకొని ఈ పేషెంట్కి ఏ విధంగా అయితే సూటబుల్ అవుతుంది మా ట్రీట్మెంట్ అనే దాని మీద మేము యునానీలో ట్రీట్మెంట్ చేస్తాము. యాక్చువల్లీ ఏంటి అంటే ఇప్పుడు సార్ వాళ్ళు చెప్పినట్టు పాలియేటివ్ కేర్లో పెయిన్ రిలీఫ్ దానికోసం అన్నారు. అది మెయిన్గా మేము జోగరాజ్ గోగుల్ అని హబ్బే జోగరాజ్ గోగుల్, హబ్బే ఉస్తకుద్దస్ అండ్ రోగనే సుర్క్ ఇలా మేము పెయిన్ రిలీఫ్కి అనేసి మసాజింగ్, ధల్లక్ ఇంపార్టెంట్ ఇక్కడ, తక్దీర్, ధల్లక్ ఇందులో యునానీలో మెన్షన్ చేస్తామన్నమాట. ఇది కూడా స్టెప్ బై స్టెప్. ఇది కంప్లీట్గా బ్రీఫ్ ఎక్స్ప్లెనేషన్ నేను ఇవ్వలేను, ఎందుకంటే ఇప్పటికే సార్ వాళ్ళు ఆల్మోస్ట్ అదంతా మాకు రిలేటెడ్గానే ఉంది. సో నేను షార్ట్గా చెప్పేశాను. ఇందులో వచ్చేసి ఎక్కువగా మాజూన్స్ ఉంటాయి, మాజూన్స్, సుఫూఫ్ అండ్ హబ్, కుర్స్ అంటే ఇవన్నీ టాబ్లెట్స్, క్యాప్సల్స్ అండ్ చాలా బీపీ ఉంది కాబట్టి ఇతనికి మాజూన్స్ ఇవ్వకూడదు. ఈయన కంప్లీట్గా సపరేట్గా సుఫూఫ్, కుర్స్, హబ్ ఇలా ట్రీట్మెంట్స్ అన్నిటి ఎవరెవరికి ఏ విధంగా ఇవ్వాలనేది ఇవి కాంపౌండ్ డ్రగ్స్ మీద డిపెండెన్స్ ఉంటుంది అనమాట యునానీలో. ఓకే, థ్యాంక్ యూ సార్. Thank you.
Thank you, ma'am. Thank you so much for your valuable insights. I request Dr. Linga Gowda Garu to present the memento and certificate of appreciation to Dr. Anjaneyulu Konda Garu, Dr. Mohammad Irfan, and Dr. Jai Krishna Kulamarva. Please, I request Dr. Linga Gowda Garu to present the memento and certificate of appreciation. Dr. Anjaneyulu Konda Garu, Dr. Mohammad Irfan, and Dr. Jai Krishna Kulamarva Garu. Okay. Firstly, to Dr. Anjaneyulu Konda Garu. Give your round of applause. Next, to Dr. Mohammad Irfan, sir. Join your hands. Dr. Jai Krishna Kulamarva Garu. Please join your hands. Thank you so much, sir. I request Dr. Kati Srinivas Babu to present the memento and certificate of appreciation to Dr. Arul Amuthan. Next, Dr. Mallikarjun Garu. Next, to Dr. Saujanya Garu. Give a round of applause. I invite Dr. Umesh Akala Devi Garu to present the memento and certificate of appreciation. I request Dr. Nur Sahir Khan ma'am to felicitate and present the memento to Dr. Linga Gowda Garu and Dr. Kati Babu sir. Give a round of applause. I request Dr. Niru Sahakar ma'am to felicitate Dr. Kati Babu sir. Thank you, Dr. Mohammad Irfan sir, Dr. Linga Gowda sir, and Dr. Kati Babu sir for your insights and intervention for the symptoms and the pain management. I request to stay back. Except Dr. Mohammad Irfan sir and Linga Gowda sir and Kati Babu sir, I request the speakers to stay back for the next panel of discussion on the test. I request Dr. Mohammad Irfan sir, Dr. Linga Gowda garu and Kati sir to come down from the dais. You can come back to the podium. Yes, sir. Dr. Linga Gowda sir, you can please come down. And Mohammad Irfan sir too. Yeah. I hand over this program to Dr. Pragna.
The next session is about management of post-CVA, that is cerebrovascular accidents and spinal cord injury. Post-CVA management focuses on rehabilitation, that is physical, occupational, speech therapies, and risk control. Spinal cord injury management emphasizes on physical therapy, pain control, and adaptive technologies. Both require personalized, ongoing care. Now I invite Dr. Umesh Akaladevi onto the stage. He has completed UG from PBH Medical College, Chandrapur, Nagpur University in 1997. He is pursuing PG, MD Homeopathy in Pediatrics at Hamsa Homeopathy Medical College, Hospital and Research Center. He is a homeopathic physician and the founder of Hamsa Homeopathy Network Clinic, Hyderabad since 2006. General Secretary of Shreyan Ishan Educational Society, Hyderabad. He is also founder director of Hamsa Homeopathy Medical College, Hospital and Research Center. He is the General Secretary of Private Homeopathic Medical College Managements Association, Telangana. He is the Joint Secretary of Federation of Private Homeopathic Medical Colleges in India. Now, I invite the chairperson of the session onto the stage, Dr. Pranab Kumar Basu, MA PhD, B.Ed, retired assistant headmaster, volunteer in palliative care, counseling the cancer patients and families. Life member of Indian Association of Palliative Care, International Death Dowla Foundation, life member of NAPCAM, that is National Association of Palliative Care for AYUSH, and integrative medicine. Certified in fundamental palliative care from Pallium India, in Arohan from Pallium India, in psycho-oncology, in death dowla, in death and dying, compassionate bereavement approach, the essence of caring for the dying and grieving, healing through grief, death, the final stage of growth, Elizabeth Kubler-Ross Foundation. He edited the book, A Beginner's Guide for Care of the Dying. He was awarded the Molly Dam Award. He is the author of the book, Positive Life Transformation, A Blessing of Bereavement. Now, I invite the moderator of the session, Dr. Ravi Lagnajita, PG Guide, Professor and HOD of Department of Organon of Medicine and Philosophy, Hamsa Homeopathy Medical College, Hospital and Research Center. I request Dr. Ravi Lagnajita to continue the session.
Good morning, everyone. I would like to invite Dr. Umesh sir to start the session. Thank you, sir.
Okay. Check. Am I audible? Is it better? Yeah, good afternoon, everyone. I hope you are, I can't say enjoying, but you are gaining enough knowledge, taking back something new, right? Especially with other systems. My session, I'll just complete it in 5 minutes. I'll not bore you. Before I, start my presentation, mostly it is slides. I'll not be talking much. You will understand what I wanted to say. Actually, we wanted to present a case, but no, it's a very lengthy one. So, cut short, I'll finish it off in 5 minutes. So, before I begin, I want to share my experience of working in Yashoda Hospital, Somajiguda, from 99 to 2001. So, in those 2 years, I was posted into different wards and special care, like ICU. And finally, the lengthiest part of my as a DMO was in neuro-intensive care unit. And I thank Dr. Ranganathan. He was the neurosurgeon. He gave me an opportunity in spite of coming from a homeopathic background. And Dr. S.K. Jaiswal, who is the neurophysician. They are famous now. They are still working in some hospitals. But during that time, I was in the NICU in different, ships. I was looking after the head injury cases, the spinal surgery cases, and the stroke cases. And most of them end stage. They undergo, in stroke cases, there's a severe hemorrhage. They undergo decompression, craniotomy, and sometimes craniectomy. And then, the last part of the life I've seen. I have very much a hands-on experience, so I chose this topic today. But let me tell you, the biggest experience that I have embraced homeopathy, and I should say, the major part of my treatment is by homeopathy only. And when it comes to pain management, I myself use diclofenac sodium paracetamol. I just want to let you know, if there is a pain, you need not suffer. You have some emergency, you have to attend this seminar, and I have a very severe headache. I can't sit in the home. Maybe I can try my medicine, but painkiller is sure shot. So at times when it is needed, painkillers are needed, are to be prescribed, or you can also use. So we'll start. So today's topic, management of post-CVA and spinal cord injury. It will be only mostly an overview. So it's a specialized area of medical care that focuses on providing relief from pain and other symptoms associated with serious illness. It aims to improve the quality of life for patients and their families. So palliative care for post-stroke patients will be, it's more to do with pain management, fatigue, dysphagia, and improving quality of life. The palliative care for post-stroke patients is pain management, as I told you, fatigue reduction, communication support, and emotional support. And for the spinal cord injury, it will be mostly mobility assistance. Of course, pain management is also one important part. And I am dealing with a case of complete section of the cord. A young boy, 26-year-old, he met with an accident, and T10, T2, almost T12, the vertebrae were crushed, and he suffered a complete cord cut and complete paraplegic state. And now they have, tried to do something in surgery, but it was limited. So known patients, they, it was brought to me. The patient was in hospital only. I visited once, and the best part, of my 20 years of homeopathic practice, I've had very good experience with one medicine with spinal cord injuries is Bellis perennis. Amazing. And now the patient with support, with like a physiotherapy and other support system, he is now able to walk with the, not the crutches, it's called, there's a special assisting equipment is there, so he is able to move. He is able to feel that there is something going on with this bowel and bladder movements. So that is the, and of course, along with that, hypericum and arnica, these are the injury medicines which are required. So now what is homeopathy do? So I have already talked, I have explained. So here in aphorism 67, Hahnemann distinguishes between homeopathic and palliative treatment, noting that palliative care often provides only temporary relief and may eventually lead to the aggravation of the underlying disease. He explains that while palliation might offer immediate symptom relief, it does not address the root cause of the illness. So it is always important to take the complete case, take the whole history and then prescribe accordingly. But he also said in aphorism 68 that palliative care, while not curative, may be appropriate in cases where the disease is incurable and the goal is to provide comfort in terminally ill patients. He stresses that palliative measures should be used with caution, understanding that they might offer short-term relief at the expense of long-term health. And then again he goes on to say in aphorism 244, the use of remedies to relieve distressing symptoms when cure is no longer possible. Hahnemann describes this as an acceptable practice in cases of incurable diseases where the focus shifts from cure to alleviation of suffering. So, most important aspect of any, like palliative care will be the counseling, and it is not done alone with support groups. And one speaker was mentioning about the spiritual care, the spiritual part of the treatment in palliative care. And that is very important. So where you can engage in spiritual mechanisms too, I think even that is mentioned as mesmerism in homeopathy, organ of homeopathy. The same thing, as I told you, the choice of remedy depends on the specific symptoms and constitution of the patient, and commonly used remedies will be causticum, nux vomica, lachesis, phosphorus, gelsemium, opium. This group of drugs, like you will encounter a patient with post-CVA complications, and these are the drugs which will be indicated. You can take home back.
Sir, 2 minutes more.
And regarding the spinal cord injury, it will be, as I told you, I kept this on top: Bellis perennis, Arnica montana, Hypericum, Ruta, Symphytum, Causticum and Plumbum met. And now, the same thing: compassionate care, symptom management, support for families and improved quality of life. Thank you.
Thank you very much, sir, for your wonderful presentation of putting the system of homeopathic so respectfully. I would like to invite our next presenter, Dr. Anjaneyalu Konda from Allopathic System.
There is no slides. No slides.
Color mic.
Yeah, okay. This is also okay. No.
Hello. Is it working? So, post-CVA and spinal cord injuries. So, in palliative care, already patient got treated in acute phase in ICUs. Simple ga cheppalante CVA blood clot avvachu, ledante fall avvachu, ledante spinal cord injury avvachu. Din tarvata acute care kosam they'll go for ICU treatment. Later they'll go for rehabilitation therapy. Then they'll move for the palliative care. So I'm talking about the palliative care only, where the person is totally, there is no cure at all. So we won't involve in any curative measures, only we'll give the symptomatic care. But the approach is holistic approach, like physical, psychological, social, spiritual, and financial. We'll look after all these things. In my home care, most of the patients are post-CVA and spinal cord injuries. Mostly they are on the bed. For physical treatment, for their well-being, they need a Ryle's tube or a NG tube. They may need one catheter. All the time they need an enema, suppositories to maintain their life and live in a dignity with a comfort. Of course, pain we already dealt, pain medications are there. Physically we can make them happy and comfort with the medications. Whatever the system, we can support that. But we won't change the medicines, whatever given for the maintenance dose. At the same time, we look for their happiness, because the period is very short for some patients, but the time period is very long for some patients. They are on the bed years and years and years. The question arises, who am I on the bed? What is the purpose of life? Why I am living here? And they were used to perform some jobs. They are losing their identity. They lost economy. They lose the relationships with the family members, with the community, with the friends. We want to replace it or regain it, try to make it. So there is very less physical involvement, much other domains of care. In Sparsh Hospice or in Sparsh Home Care, we try to manage this with a holistic approach. For that, if a person is socially, kept aside, our social worker will go and talk to the family, talk to the community, make them involved, how they have to treat such kind of patients. Sometimes the family is in a burnout, not able to handle that. Every day the same situation, that doesn't make any change in the life. If you put whatever the money, whatever the time, 100% if you are giving your effort, the person will be like that only, there will be no change. The family get aversion. That's why for these patients, we consider family as a unit, not a patient as a unit. If you treat the patient, that is not enough. If you treat family along with the patient, that is the care. So that's why we'll support their financial needs with some NGO support, and we give some dry ration to the families to get it back into the dignity life, and we'll support if they are in a depression, anxiety, fear. For that, we'll take the help of the psychologists who are there in our care, and we will take help of some spiritual leaders. Of course, this is where the person is looking for, who am I? Why I have to live? Many patients wants to commit suicide, end their life, because this story never ends. Their life doesn't go. Then what to do? The person's spirituality, they look for the spirituality. They look for the spiritual distress, someone to handle. According to their believing system, we'll try to make it happen. Maybe sometimes we'll make to go to the spiritual needs along with their believing system, like in a religion purpose. Mostly with the mullahs, the culture in the Muslim, they want those kind of persons in need to talk with them, and gurus and teachers and spiritual gurus from Hindu community. At the same time, for Christians, they want chaplains, like pastors and fathers, they want to be such kind of thing. If they are associated with them, if they want to understand their life, we try to make it happen. So for spiritual connection, for social connection, for psychological connection, we'll maintain that integrity for the patient and make it happen. In that way, patient feels happy and comfort with the dignity, with a meaningful life. Of course, physically, happiness, there are pharmacological methods, non-pharmacological methods. In non-pharmacological methods, lot of rehabilitation, physiotherapy are there, we'll utilize them. And Siddha, yoga, meditation, all these works. In pharmacology, like Ayurveda, Siddha, and Homeopathy, like that, we are also having some medication to make them symptomatically good. So this is the thing we are doing from our end when the patients are in palliative care, in end of life, in hospice setups. There is no much need to cure them back and revert them back, but we can make them happy. We cannot change the exit of their life, but we can make it happier and simpler and more comfortable. That we can do from our end. So this is from my end. Thank you.
Thank you very much, sir, for your beautiful and touching session. It's really soothing to hear the words like spirit.
In Ayurveda, they say it is the 50% of the treatment you can make using the rectal route. So where their patients are bedridden, they are immobile, you can use the skin as the delivery mechanism and the rectal route through which you can administer the medicine. To make the long story short, after 2-3 months of treatment, this person who was almost immobile for 10 months, he started shaking his toes. His toes started moving, and after that, he was able to sit up with support. Then after the 3rd or 4th month treatment, we were repeatedly doing the Kerala Panchakarma therapies, where we use the Podikili, Elakili, leaf poultice and the Churna poultice massage. And we were repeatedly giving the Yoga Vasti, the combination of the enemas. Then he started standing up with support. Then after some time, to my absolute surprise, this person is roaming all over the city. This is one of the success stories that I would like to explain. He is 72-year-old, and the tragedy is once this guy recovered, this person recovered, his wife fell ill with the paralytic stroke. I don't know. I could not follow up after that particular person was healed. So, how do you differentiate whether it is ischemic or it is going to be a hemorrhagic stroke? For example, if you look at the pulse, this second pulse, which is jumping pulse, if it is very high, don't put the person in a situation where he is going to get anger or he is going to be irritated, etc. Because his blood is going to boil and he is going to have a hemorrhagic stroke. So if a person comes to me with the middle pulse, the pitta pulse, immediately I have to give them pacification, or we select medicines which are sweet in taste, like drakshadi, sukumaram, etc. We cannot give him very potentially high spicy medicines like triktu, etc. We cannot give him high lavana, salt containing medicines to him. So according to Ayurveda, we have to again classify all these things. So how do you explain what is the traumatic paralysis? So Ayurveda says even a small fall, a small head injury, a sports injury also can lead to aggravation of vata. These doshas can be aggravated by external factors as well as internal factors. That type of treatment we have tried to do with people who have had head injury, post-surgery, etc. We have gone to the home and did the treatment, but with little results. Ayurveda also warns the doctor that there are 4 types of diseases: sadhya, sukhasadhya, yapya, kashtasadhya, and asadhya. Asadhya means the physician who has written this text, Charak Samhita, he has told that it is impossible to treat. So yapya is those diseases like diabetes, bronchial asthma, etc., which when you are giving the medicine, it is under control. When there is an external factor, a seasonal change, etc., there is some allergic food which is going inside, then there is an aggravation of the disease. So the physician has to understand that there is no illness which is easily treatable. All illnesses are classified into easily treatable, difficult to treat. Yapya means that which you are giving the medicines that are controlled, but there are some diseases where you have to be careful. Don't assure the patient that you will be able to heal everything. So this type of traumatic injuries, sports injuries, head injuries, neck injuries, spinal injuries, etc., these fall under the asadhya factor. There comes the allopathic stem cell, etc., etc., the latest research which is going on. Along with that, definitely Ayurveda will help in the lymphatic circulation, blood circulation, keeping the limb movement, keeping the muscles, a disuse injury cannot happen. So that type of treatments are there in Ayurveda. So this is my personal experience that if it is a stroke which is because of a ischemic, where the blood circulation, the blood clots have happened, we have got Ashavargam Kashayam, we have got beautiful Ekangavir Ras, we have got Rasaraj Ras, etc., herbo-mineral preparations which are prepared out of gold and silver, where we are having very good results. So people who are carried into our, OPD, After some time of treatment with massages and the podikili, elakili, vasti, etc., we are getting very good results. I would like to just share these few, my thoughts about this particular. Later on, if there are any questions, I would like to answer about this.
Thank you very much, sir, for your beautiful instructional speech, sir, and I'm really sorry for the technical mistake of your name.
No, actually, Dr. Kameshwar was supposed to come and be with you.
There was a little technical mistake.
He's
Sorry
my friend
for that,
because there was some incident at his home. He has asked me to.
Thank you, sir. Thank you. I would like to invite the next speaker, Dr. Mallikarjun Garu from the System of Naturopathy.
So, once again, a very good afternoon to all of you. So, I would like to tell something about how we manage the CVA and spinal condition or naturopathy system of medicine. Usually, as you all know, you are all medicos, you know, you have two etiological factors. One is hemorrhagic and another is ischemic, right? So, the management of any CVA or any ischemic stroke or any spinal cord injury start with muscle strength grading. So, we have to first grade at what stage they have the muscle strength, and then we have to plan the exercise therapy to activate the motor points. So, you all know, I assume that you have 0 by 5, you have 1 by 5, 2 by 5, 3 by 5, 4 by 5. So like that we have muscle strength grading, then we have to go for, we have to choose according to the grading, we have to choose the management, whether you give the passive exercises or active exercises, or once the patient becomes maybe around 4 by 5 against the gravity, you can move the lips, then we can go for resisted active exercises. So like that we manage the case, we try to activate the motor points and then strengthen the muscles so that he can go for his normal daily works. If suppose someone is a tailor, he needs to go to his work. That is called rehabilitation. Suppose someone is going for some job, white collar job, like a computer operator, he should be able to operate the mouse, he should be able to operate or type. So that is what rehabilitation is. If this is not possible, if residual paralysis or if the person, the extent of damage is to such a extent that we are not able to send him back to his normal works, right? So some residual paralysis is there. Then we need to give the palliative care. We have to support him so that they will not have any kind of psychological or emotional disturbances. Apart from that, because I told you some cases they are such a fashion that they may not have bladder and bowel control also. So the family also is at receiving end. So there is a social trauma, psychosocial trauma is there. Apart from the physical trauma, the whole family gets affected. Their economy gets, as one of our speakers was telling, the whole economy gets affected. So these are the aspects we have to take care. First is rehabilitation. We have to plan as early as possible, which is lacking, especially in our hospitals. So one stroke case is discharged, he does not know where to go. So he does not know the importance of rehabilitation. Many of the cases which come to our hospital, we understand that lack of any kind of this physiotherapy techniques, activation of motor point has not been done because they have gone to some, once they are discharged, they go to some rural area, they don't know the importance, or it is expensive also. Rehabilitation therapies are expensive nowadays because home visit costs minimum not less than 500 to 1000 rupees per visit, sometimes may cost 2000 also, they just stop. So they assume that he has to recover automatically. No. So he has to definitely go for rehabilitation therapies, and if it's an integrated approach, I would like to share my experiences because I have little time. Like because one of my patients who was not responding to this rehabilitation therapies. So my sister is a Ayurveda doctor. She is working as a associate professor in BMS, BRK Ayurveda Medical College. So then I requested her, why can't you give some medicine so that he starts, his muscles start responding. Then I still remember that. Bhrotvat Chintamani, there was a drug she has given to that patient. It was a hemorrhagic CVA. So BVT she has given. And to my surprise, second day, the motor point started activating with the physical therapist. So the holistic approach. Then I said few of the infection cases also I requested her. So drug of choice was Yogendra Ras. So these are the drug of choices, she said. For infections, ischemic strokes, we go for Yogendra Ras, and hemorrhagic, we go for Bhrotvat. That is their field, so I am not going into details of that. So what I found is that holistic approach, in especially CVA cases, is tremendous. We can integrate it. And I would like to share, because it's a CVA, but I would slightly deviate from the topic. It's a personal experience, how the holistic approach helps in our integration. Or giving the elevation from the suffering of the mankind. So my mother had corns in her feet. Multiple corns were there. So my job was every day I used to go and clean the corns. So there was no respite after all these treatments. So then we approached one of the homeo doctors. So they gave homeo medicine. To my surprise, I found that after 1 month there was not even a single corn in the feet. So holistic approach, especially not only in CVA or spinal cord injuries, it helps in every aspect of the disease. Every system has got its importance. So especially post-traumatic spinal cord injuries, physiotherapy is one of the important aspects which has to be integrated with all the systems, because once you do not activate the motor points, you cannot rehabilitate them. So it is lacking in our system. So nowadays awareness is coming. Now we are finding number of rehabilitation centers after the post-CVA and post-traumatic spinal cord injuries. From the hospital they are going for some rehab centers, but it's very expensive. So many of them are lacking. So it is time where we integrate this and start these wellness centers in each and effort, or common can have the reach. So I feel that naturopathy and yoga have an important miracle, some latest innovation scientifically, how to attach these cords. But minimum injuries, like one of our doctors was telling that there was a disc bulge, right? So it was responding to the treatment from the Ayurveda field. So we have a lot of these kind of cases. In naturopathy also we have a lot of case studies where minimal injuries, we can just rehabilitate them. But if it is a complete traumatic resection kind of a thing, then palliative care is one of the important aspects, where again these alternative systems, we cannot say alternative systems because our Indian systems we have to say, so they are not alternative to anything. So these have a greater role because they have bladder incontinence, they may have constipation, they may have where we can go for relief with our modalities of treatment. Apart from that, pain management. So atrophy, disuse atrophy, and especially spinal cord injuries, you have disuse atrophy. Suppose some medical revolution occurs and there is treatment for that, but by that time the complete muscles are atrophied. So we have to prevent that. For that, our systems like massage therapy, electrotherapy, like giving galvanic currents, Faraday currents, and maintaining the muscle tone is one of the important aspects. Apart from that, subluxations. In CVS, we have a lot of subluxation of the shoulder joint. So ultimately, when the motor points get activated, you will not be able to even move the shoulder. So I'll conclude, ma'am. So we have to see that there is no subluxation. The subluxation is how to correct it. These techniques have to be learned by all the doctors, not only physiotherapists. Every system of the doctor should know how to prevent these kind of subluxations, and how to activate the motor points is one of the challenging tasks. So after giving medication also, complete rehabilitation can be done. I feel only once they go for the exercise therapy. So initially, like cryotherapy or electrotherapy will help in activating the motor points. But once these motor points are activated, you have to strengthen it. For that, you have to go for massage therapy, because there is a false notion that massage therapy increases the stiffness. Yes, when initial stage if you give massage therapy, it will increase the stiffness. But once the motor points are activated, the massage therapy definitely helps in strengthening the muscles. So we have to plan it scientifically. So that is the important issue, and we have to guide the patients to opt for the rehabilitation, compulsorily exercise therapy has to be done in especially CVA and post-traumatic spinal cord injuries. Any 1% chance of revival also we should not leave. We have to continuously go for rehab, we have to continuously go for exercise therapies, and it should be affordable also, cost effective. The patients, every patient, even in rural areas, it should be available. Because what we find is in cities we have a lot of centers, but in rural areas we don't have this kind of centers. So there this important comes. So with that, I once again thank the management of Hamsa for giving me an opportunity to share my thoughts. Thank you.
Thank you very much, sir, for this informational session about how to manage, rehabilitate CVA through integration. Thank you very much. I would now like to invite Dr. Arul Amrutam from Siddha.
Please project the PowerPoint second. So very good afternoon to all. So in Siddha, the Verma therapy is very much useful in the stroke patient, but after within 10 days or within 1 week, if you start the intervention, definitely we can show maximum improvement. But the question comes, what do you have after 1 month, after 6 months of CVA or spinal cord injury? Really, we have very, very less options. So the things which we can easily adopt are, first thing is nutritional supplements. So there are dietary, meal is a medicine. That is one culinary medicine, one of the important aspect of the traditional Siddha medicine. So we advise them to consume a lot of easily digestible meal-based supplements along with the herbals. For example, Siddha cordifolia, Shirabala, that root plus some of the protein-rich green gram groundnut. So there are recipes are available in our literature and we follow. We make all together. We tie in the cloth as a bundle and we give the patient. Every day when they prepare rice or ganji, they have to put one bundle, they have to boil it and they have to use it. So this is how the nutritional aspect is taken care. Then blood thinners, there are many dietary things are there. They are having blood thinning property. For example, garlic, ginger, these all, already I told ginger, garlic, honey, ginger honey, same way garlic honey. So similarly, the lot of dietary, based herbal diets are available as a maintenance therapy. And other thing, yoga, exercise and Varmasanam. So Varmasanam is an important practice where the Varma is combined with the asana practice. For example, if the patient can't do particular asanas, so we can actually help them to do the asanas. You see that every 2 hours, the person should change his position. If he is completely on the same position, more than 2 hours, that is going to affect his nadi pattern. So there are 12 nadis in the body. Every nadi will take 2 hours to activate with one internal organ, with the connected internal organ. So there are 12 organs. So if the patient is lying down without any physical movement, or you are sitting in one side, you are sitting in one side of the body giving pressure, after 2 hours, you will slowly feel that you should turn on other side. It is because it's a natural phenomena that those channel has to be activated. So that part we have to take care, and we can do that channel activation. We know the cycle, we know the every 2 hours what cycle should be activated. So those Verma points along the channels, we know that. So those points we can do the manipulation. So that will be helping us too much. And there are herbals like Brahmi, that's a centralized sciatica, Brahmi, Ashwagandha. These are Celatus paniculatus and Semicarpus anacardium. These are the herbal-based simple supplements in the ghee form or in the churna form, kashaya form we are giving. And most importantly, the andathalam. Andathalam is nothing but the egg yellow yolk. From that one oil is there. That is excellent neuroregenerator. In Chinese medicine also they are using, in Siddha we are using excellent neuroregenerator. That is very just 10 drops they have to every day consume. That's all. So it will have a lot of neuroregeneration property. Many research also have been done. Apart from that, the external oil. So when we choose external oil, patient may have muscle wasting, so then we have to choose different oil. Particular oil we have to use with the massage. After soon you can see within 1 month you can see the muscle bulkness. So If the joints or muscles are stiff, then we have to use another oil, Vasaviyanai. If there is a rigidity, then you have to choose different oil. And if the flaccidity is there, then you have to choose different oil. So this is how we actually work in the clinic. So these oils are very easily patient attenders can apply themselves. No need of any instruments. They can do mild massage or whatever they know they can do. Just applying oil itself enough to nourish the muscles, nerves and bones, because they act as a transdermal drug delivery system, So if you apply, it will be taken because of the lipophilic nature. And external therapy, Verma massage therapy. This is again very important. So we use this Verma massage therapy. So it is because, when you look at the embryology, you look at the one point, here, this point, below the nostril. You look at this point. Embryologically, that point has connection from various organs. It is 3 parts are coming from different place. Finally, it will unite in this place. So it is having still connection with the other organ. So a part is starting from here. It will extend here. This will extend from backwards. So this is how, like dermatome theory, cardiac angina pectoris patient will have pain here. Because when embryology is there, there is a link. Same way, this is the basic principles of Verma therapy. So wherever points you see, those points are having embryological connection with the other internal organs. So by manipulating these points at a particular pressure, you are able to manipulate the internal organs and related channels. So this is how, even the patient is not able to do many things, we can activate nervous system, muscle system, heart, lung. So those internal organs manipulation can be done. So this is how we help the patient. But again, we know that these are maintenance therapy only. The reversal is very difficult to do in this stroke and post-stroke patients. So that's all from our side. Thank you.
Thank you very much, sir, for your colossal presentations on oils and herbs, sir. Thank you very much. Now I would like to invite Dr. Saujanya from System of Unani.
Brain attack ante one type of paralysis. One type of paralysis ki Unani treatment lo actually important of dhalak ante massage with oils, rogani badam, rogani surk ilantivi massaging lo important of the Unani treatment. And din tarvata joshanda decoctions ante intake of medication anamata. And massage and hammam అంటే హెర్బ్స్తో కూడిన బాతింగ్ అనమాట. ప్యారలైజ్డ్ ఉన్న బ్రెయిన్ రిలీఫ్ కోసం మజిల్ థెరపీ అంటే ఆయిల్స్ మసాజ్ చేయడం, కూల్నెస్ ఆఫ్ బ్రెయిన్. అండ్ ఇంకొకటి డైటోథెరపీ. ఎక్సర్సైజ్ ఈజ్ వెరీ ఇంపార్టెంట్ ఇన్ యునానీ ట్రీట్మెంట్. అండ్ ఇందులో ఎక్కువగా మనం వాడుతున్నాం ఏంటంటే హల్వాస్ ఎక్కువగా యూస్ చేస్తాం యునానీలో. ఇత్రిఫల్ అండ్ జవారిష్, లవూక్ అని ట్రీట్మెంట్స్ ఇందులో ప్రొవైడ్ చేస్తాం. అండ్ ఇంకొకటి సుఫూఫ్ అండ్ పౌడర్స్. అంటే సుఫూఫ్ అంటే ఇందాకే చెప్పాను, కొంతమందికి సుఫూఫ్ ట్రీట్మెంట్ చేస్తాము, కొంతమందికి మాజున్స్, కొంతమందికి లవూక్. అంటే పేషెంట్ ఏ విధంగా అయితే అంటే సఫర్ అవుతున్నారో దాన్ని బట్టి యునానీ ట్రీట్మెంట్ బేస్ తీసుకుంటాం. అంటే సఫ్రా, సౌదా, బల్గం అండ్ దమ్. దీని రిలేటెడ్గా కూడా ఇందులో పారాలసిస్ కూడా మేము ట్రీట్మెంట్ ఇస్తాం. అండ్ ఇంకొకటి ఏంటి అంటే ఇందులో మెయిన్గా ముంజిజ్ అంటే 21 days ఆఫ్ పార్ట్ ఆఫ్ ద ట్రీట్మెంట్ అనమాట. ముంజిజ్ అండ్ 3 days ముసిల్ అండ్ 3rd day ఎనర్జీ రావడానికి ట్రీట్మెంట్ స్టార్ట్ చేస్తాం. యాక్చువల్గా ఇత్రిఫలే ఉస్తుకుద్దుస్, హబ్బే జోగ్రాజ్, హబ్బే అజారకి, ముఖవే దిమాగ్, హబ్బే అస్గన్ ఇలాంటివి బ్రెయిన్కి ఏమంటారు స్ట్రెంగ్త్ ఇవ్వడానికి ట్రీట్మెంట్లో ఇవి యాడ్ చేసుకుంటాం. సో ఈ ట్రీట్మెంట్ ద్వారా ఏమవుతుందంటే బ్రెయిన్లో క్లాట్స్, ఇంజురీస్ ఏమైనా ఉంటే ఈ ట్రీట్మెంట్ ద్వారా మసాజ్ అండ్ ఈ ఇంటేక్ ఆఫ్ మెడిసిన్స్ నుంచి రిలీఫ్ అయిపోయి బ్లడ్ క్లాట్స్ కూడా తగ్గిపోవడం జరుగుతుంది అన్నమాట. అండ్ ఇంకొకటి యునాని వచ్చేసి ట్రెడిషనల్ మెడిసిన్ కాబట్టి కంప్లీట్గా హెర్బ్స్తో కూడిన ట్రీట్మెంట్ మాత్రమే ఇందులో అవైలబుల్ ఉంటుంది. ఇందాక న్యాచురోపతిలో సార్ చెప్పారు కదా, మసాజ్ ఇస్ వెరీ ఇంపార్టెంట్ ఆఫ్ ద పార్ట్. అంటే పర్సనల్గా నేను ఫీల్ అయిన ఒక సిచ్యువేషన్ చెప్తాను. మా ఫాదర్కే రీసెంట్లీ ప్యారలైజ్డ్, అంటే వన్ హ్యాండ్ అండ్ వన్ లెగ్. సో తనకి నేను కాన్ఫిడెంట్గా ఇక్కడ చెప్పట్లేదు, కానీ కాన్ఫిడెంట్గా నా ట్రీట్మెంట్ నేను నా పర్సనల్గా నా ఫ్యామిలీలో ఒక మెంబర్కి నేను ఇచ్చిన. ప్రజెంట్గా మా డాడీ వచ్చేసి యాక్టివేట్, అంటే నార్మల్ పర్సన్ ఎలా ఉన్నారో అలానే ఉన్నారు. అంటే వన్ ఆఫ్ ద ట్రీట్మెంట్ గ్రేట్గా చెప్పుకుంటున్నాను. అంటే అదర్గా నేను చాలామంది నాకు సపోర్ట్, అంటే అలోపతిక్ ట్రీట్మెంట్ వాడండి తొందరగా రిలీఫ్ అవుతుంది. బట్ మన యునాని మన ఆయుష్ డిపార్ట్మెంట్లో ఇంత మంచి ట్రీట్మెంట్ ఉన్నప్పుడు అద్దరు చూస్ ఎందుకు? సరే నేనే పర్సనల్గా సింగ్ అండ్ ఆయిల్ మసాజ్ ఇవన్నీ నేను పర్సనల్ ఆంజనేయులు సార్ అండ్ అభిజిత్ సార్కి నేను థ్యాంక్ఫుల్ చెప్పుకుంటున్నాను. అండ్ ఇంకొకటి ఏంటంటే ఇందులో ఈ ట్రీట్మెంట్లో మేమిచ్చే జోషాందా ఈజ్ వెరీ ఇంపార్టెంట్. అంటే లైక్ సిరప్ అన్నారు కదా సార్ ఇందాక, సిరప్స్ కాకుండా అది షర్బత్ వైజ్లో ఇస్తామన్నమాట. జోగ్రాజ్ అంటే పెయిన్ కిల్లర్స్, జోగ్రాజ్ గోగులు, ముఖవ్య దిమాగ్ అంటే మైండ్ని కంట్రోల్లో పెట్టడానికి ముఖవ్య దిమాగ్, అండ్ డికాషన్స్ అంటే ఇంటేక్ ఆఫ్ ప్యూరిఫైయర్, బ్లడ్ ప్యూరిఫైయర్. ఏదైతే క్లాట్స్ ఉన్నాయో ఆ క్లాట్స్ని అంతా నార్మల్ కండిషన్ తెచ్చి అంటే సర్క్యులేషన్ అనేది నార్మల్ పొజిషన్కి వచ్చి రిలాక్స్డ్కి రావాలి పర్సన్. సో మా ఫాదర్ కూడా నేను తీసుకున్న ట్రీట్మెంట్ 3 monthsలో మా ఫాదర్ నౌ ప్రెజెంట్ హీఈస్ ఆల్వేస్ ఓకే. హీఈస్ రిటైర్డ్ హెడ్ మాస్టర్ మా సార్, మా డాడీ. సో ఇప్పుడు కూడా నార్మల్ పర్సన్ లాగా అందరికీ టీచ్ చేస్తున్నాడు. ఏ దాని గురించి అంటే యునాని ట్రీట్మెంట్ తీసుకున్న నేను ఇప్పుడు ఈ విధంగా నేను ఇంత స్ట్రాంగ్గా ఉన్నాను. మీరు కూడా న్యాచురల్గా ఆయుష్ డిపార్ట్మెంట్లో ఉన్న హోమియో కానీ, ఆయుర్వేదిక్ కానీ, సిద్ధ కానీ, ఫిజియోథెరపీ కానీ ఇలాంటివి చేయించుకొని ది బెటర్ ఆప్షన్గా న్యాచురల్ మెడికేషన్కి వెళ్ళి రండి, ట్రెడిషనల్ మెడికేషన్కి రండి నాట్ అని ఇన్ఫార్మ్ చేస్తున్నా. దాని గురించి అని నేను ఇక్కడ 1 సెంటెన్స్లో చెప్పాలని ఏమనుకుంటున్నానంటే, క్రానిక్ డిసీజెస్కి న్యాచురల్ ట్రీట్మెంట్ ఈజ్ ద బెస్ట్. ఆ ఒక్క వర్డ్ నేను మీ అందరికీ అది రిసీవ్ అవుతుందో కాదో నాకు తెలియదు. బట్ నేను చెప్పేది ఏంటంటే, క్రానిక్ డిసీజెస్ అంటే ఆర్థరైటిస్ ఉండొచ్చు, బీపీ ఉండొచ్చు, షుగర్ ఉండొచ్చు, ఇది ఇన్ కేస్ ఏదైనా క్రానిక్ డిసీజెస్కి ఎప్పటికీ అలోపతికి వెళ్ళొద్దు అనట్లేదు. బట్ ఇట్ ఈస్ ఎమర్జెన్సీ. కానీ క్రానిక్ డిసీజెస్కి మాత్రం మెయిన్గా న్యాచురల్గా మన ఇంట్లో వరకు ఉన్న ట్రీట్మెంట్స్ని కూడా అవైలబుల్గా పెట్టుకోవడం మంచిది. సో ఇది యునానీలో ది బెస్ట్ పార్ట్ ఆఫ్ హమామ్. అంటే దీని నుంచి ఏంటంటే బాడీకి రిలాక్సేషన్ ఇవ్వడానికి హెర్బ్స్ అన్నీ ఒక డికాషన్, అంటే డికాషన్ లాగా ఇంటేక్ ఇచ్చి బాతింగ్ లాగా టబ్ యూజ్ చేసుకొని అందులో రిలాక్స్ ఆఫ్ మజిల్స్ అనమాట. అదొక పార్ట్. అండ్ మసాజ్ ఒక ఇంపార్టెంట్ ఆఫ్ మసాజ్. అంటే ఎక్కడైతే ఏ ఏరియాలో అయితే మనకి మూమెంట్స్ అనేటివి లేవో ఆ ఏరియాలో మసాజింగ్, రోగనే బాదాం, రోగనే సుర్ ఇలాంటివి అంటే ఒక్కొక్క పర్సన్కి ఒక్కొక్క అంటే ఆయిల్ రియాక్ట్ అవుతుంది అనమాట. అది మనం బేస్డ్ ఏం తీసుకుంటామని సఫ్రా, సౌదా, బల్గం, దీని బేస్డ్ ఆ ట్రీట్మెంట్ స్టార్ట్ చేసుకుంటాం అనమాట. థ్యాంక్ యూ ఫర్
Thank you, ma'am, for enlightening us about a bit less known system. Beautiful presentation. Thank you.
Thank you, Dr. Umesh Akaladevi, Dr. Anjaneyulu Konda, Dr. K. Jayakrishna, Dr. Arul Amrutan, Dr. Mallikarjun, Dr. Saujanya for sharing your experiences and insights. Now I request Dr. Pranab Kumar Basu to conclude the session.
Actually, I am overwhelmed with the spirit of NAPChem and NAPChem Hyderabad chapter and the spirit of the team Hamsa Homeopathic Medical College Hyderabad for carrying on the integrative palliative care in the field of healthcare. And we know that palliative care provides quality of life. And every pathy, every treatment, there is the scope of palliative care, and we are here for integration and coordination of between each pathy, each treatment, including allopathy and other the traditional treatments also. One thing I'll say that palliative care doesn't have a full stop. Care doesn't have a full stop. It continues from the patient to the family and on. So I wish the spirit of this conference doesn't have any full stop. It must continue to for the mission, for the vision, which is really noble mission. Thank you very much.
Thank you for your insight, sir. Now I request Dr. Ravi Lagnajita to conclude the session.
In very short, when generally integration of different other field of works happens, they try to create a new thing. But when the integration in the medical system happens, they fabricate the health to make the people to create the new things. So thank you very much all the speakers for your contribution on this stage. We are highly obliged and thank you very much. Now I think, shall I announce lunch break?
Thank you for your insights, ma'am. Now I request Dr. Ravi Lagnajita to present the memento to Dr. Umesh Akaladevi and Dr. Pranab Kumar Basu. One by one. Dr. Umesh Akaladevi. Now I request Dr. Ravi Lagnajita to present the memento to Dr. Pranab Kumar Basu. Give a round of applause. Now I request Dr. Srinivas Babu Katti to present the memento to Ravi Lagnajita. Thank you, sir. Thank you, ma'am. Now I request the chief guest to follow Dr. Faisal for the lunch. All the chief guests will be escorted by Dr. Faisal to the for lunch.
People have just given me 5 minutes, but I'll ask for a little more. But still, thank you so much. The details of the course and my contact number, I'll leave with the management of Hamsa. And looking forward for your inquiries and,
May I have your attention, please? All the delegates that has registered for the workshop will receive their e-certificate through the mail ID that you have provided. But you have to clear your Google storage first, or else you won't be receiving the e-certificate. Thank you.
Good afternoon, everyone. Moving forward to the next section. We have the next topic, the psychosocial aspect of palliative care. It addresses emotional, social, and psychological needs, helping to manage anxiety, depression, and relationship while enhancing quality of life and maintaining dignity. I call upon stage the speaker for this session, Srimati Sharada Lingaraju. She is a compassionate counseling in charge and psychologist with extensive experience in palliative care and emotional support at a sparse hospice. In a palliative care, committed to delivering empathetic care, improving patients' outcomes, and supporting families through challenging times. She demonstrates strong interpersonal skills and a deep understanding of end-of-life care dynamics. I invite the moderator for this session, Dr. Fatimunisa Sheikh, BHMS MD Psychiatry, Assistant Professor in Department of Psychiatry, Hamsa Homeopathic Medical College, Hospital and Research Center with 25 years experience of infertility.
It's a pleasure to be here, and I thank everybody who gave me this opportunity, NAPCAM, Hamsa, and especially my colleague Dr. Anjanelu, who said that people need to be aware of this psychological component of care also for the patients. The more time we work or spend with patients in palliative care, we move away from science and we move more towards humanitarian angle or the art of taking care of them. That's my personal understanding from my experience. And after listening to all these professionals that have spoken from different walks of medicine, I just understood, or my understanding is that all of us aim for one thing, that is that the patient's well-being. But only the how part is different. The how part of Ayurveda is different, Unani is different, and Siddha is different, and Homeopathy is different, and modern medicine is different. But one fundamental thing most of us generally forget over a period of time is a person is approaching us because he has a health issue, because he has some concern. That is, except for that part of a choice doctor, like whether he chooses Unani, what about all the needs of that person and how the disease is impacting their emotional well-being? Is he scared? Is he worried because he had some sort of a habit? Is he feeling guilty about it? Or is he angry at somebody that, because of certain reasons that he's not in a position to get some treatments done for him? So all these emotions are there within him. And there are certain times because of these diseases, we see in our practice that relationships break. Just by addressing their physical needs does not suffice to make them feel that they are taken holistically. There should be some psychologists handling all these issues. Should we connect with them? Well-being is being practiced. That's how it is done. When you know that you're dealing it from that point of your, from that place of your heart. There's science to it, there's an evidence-based science to it. There are a lot of, when you take care of a patient, we see a spectrum of emotions. You want me to take her to, USA or some Timbuktu, we'll do anything possible. There are people who say, how long do you think she's going to live? Can you do something to see that the patient goes? These are all emotions. And it is not right for all of us when you are in a healthcare setup, when you are in a hospital or a health. How I do? Okay. As I said, the role of a psychologist or the role of, the purpose, why we should be having this thought of psychological well-being for the patient or the family is because they will have so many emotional needs, spiritual needs, and mental needs. These are all the needs we should be addressing if you're targeting their well-being. Cure is different, caring is different, but well-being is holistic. It's all pervasive. Unless you're handling their life as a whole, it's not possible to offer well-being to the patients. So what do we do? So our goal is to see that by addressing these emotional issues, we add quality of life to their life. Patient, who kind of patient, who kind of money. Now an option is shown to him that if you have that kind of money, you can save your mom. So what is it? How do you think those people will be feeling? They'll be feeling helpless. They'll curse themselves. So these are all the different emotions. We sit and talk to them. We tell them why it is not an option for them. If I have 10 rupees, I should plan something within that 10 rupees. If I don't have 100 rupees, I cannot aim for something like, okay, 100 rupees, I'll get something. I don't have it. Unless I intentionally plan to spoil my emotional well-being. That's the type of emotional support that we offer so that they have quality of life by having mental wellness, by accepting their limitations. Mentally well doesn't mean that not having a disease. No, it's not that. Accepting your limitations is also part of mental wellness, emotional wellness. That's what we do in palliative care. This is a very important aspect of care in palliative care. What we do is, when people come to us to a palliative care center, especially when families and patients come to us, they're coming from hospitals. When they're coming from hospitals, it means that they're coming from a place where cure is offered, where they're told that the patient will get all better. But they're again at a later stage, after a few months of the treatment, they're referred to centers like us. Why are they referred? Because all the curative options are closed. They've been informed that cure is no longer a possibility. When they're coming to us, suddenly they don't know why they're coming to us. What is it that they can expect? Look, I will tell you one thing. When we started working at this place, it was very difficult for us to convince patients that there are doctors to take care of terminal patients. They would ask us, generally doctors cure disease, right? So what do your doctors do if they can't cure? That is, they take care of the symptom management or the pain management that all the doctors in the morning have spoken about. So it was not easy for people to accept that there are doctors who are specialized to take care of their comfort. So that is called their pain and symptoms. I'm at a hospital. Nobody is ready to listen to their actual distresses. So we handle all those questions, and there are methods of doing it. There are different ways of doing it. Yeah. 2 more minutes? Yeah. Okay. So here what I'm trying to tell you is, yeah, so next slide. Okay. I'll stop with the next slide. This is my most favorite part. I'll wrap it up with that. Many a times we have so many options in terms of treatments and hospitals nowadays, right? You say somebody, X person who is very close to me is diagnosed with cancer. I go to Yashoda, they tell something. I go to Baswatarakam, they tell me something else probably. I go to some homeopathy, probably they'll tell me something else. Now I have 3 options in front of me. I don't know which one to choose. Sometimes in certain cases, it is such that the patient is in a terminal stage. There is sure shot we know that the patient is not going to respond to any type of treatments, whichever type it is. Even then, they're suggested the treatments. When these people come to us, we help them take a decision. We tell them why they shouldn't go for the treatment, why it will not work for them, even if they're very rich, even if they're very affluent in the society, why they should not go. Because the goal of palliative care is to add value in terms of quality of life to these patients. But sometimes make the patients and the families understand the very clear-cut or a narrow distinction between extending life and prolonging their suffering. I'll wrap it up with one example. Say there is a patient with a terminal illness, a lung cancer, which is 4th stage. His lungs are not able to absorb oxygen from the thing. how right is it to put him on a ventilator? How many of you think it's wrong? Can you raise your hands? How many of you think that a person whose lungs have been compromised 100%, if they're suggested to put their loved one, or that patient is suggested that go onto the ventilator, is it correct? I say wrong. Why? All of you think it's correct? No, but you don't want to raise your hands? Everything will suit us. So it is very essential for all of us to be aware of what is the best suitable choice for us in the context of our disease, in the context of our emotions, in the context of our society or our social well-being or our family structure, money, everything for context. So that's where the psychological well-being comes. I think I'll stop here, ma'am. I won't be able to stop after this. Okay, thank you. Thank you, everybody. Thank you so much.
Thank you, ma'am.
Thank you very much, ma'am.
Sharda,
ma'am, I gave you more time.
You gave me more time?
Yeah, because I work in psychiatry department. I actually want to hear more. Because you are very senior. As we can see you, we don't have to go back to your biodata or something. We can see you personally here. So your valuable 3 things I think I could note. The best part was accepting limitations. I think that is very good use for our interns, our PGs also, and for ourselves also as physicians. We do get cases. As a last resort, they come to us, homeopathy, that can you do us something? So what you were speaking, we could connect it. Thank you so much for that part. And the best one was the last one, extending life and prolonging suffering, the choice. It is really a big task, and thank you so much for throwing light for that. Yeah. Thank you, all of you.
I now request Dr. Fatima Unniso ma'am to present a memento and certificate of appreciation to Srimati Sharada Lingaraj ma'am. I request Dr. Noor Sahan ma'am to present the memento and certificate of appreciation to Dr. S.K. Fatima Unisa ma'am. I hand over to Dr. Karunasri.
Our next topic is nursing in palliative care, wound care, stoma care and pressure sore. Nursing in palliative care focuses on managing symptoms, offering emotional support and enhancing quality of life for patients and families. I now call upon stage the speaker for this session is Srimati Anusha ma'am, BSc Nursing, MSc Psychology, National Fellowship in Palliative Nursing, Palliative Care Certificate Course, MNJ Cancer Hospital, Hyderabad, Life Member of the Indian Association of Palliative Care, National Fellowship in Palliative Nursing, Institute of Palliative Medicine, Kozhikode, Kerala, Complete Certificate Courses in HIV, HBV, Dementia and Alzheimer's, Pediatric Palliative Care, Advanced Palliative Care, Nursing from various universities. Nursing in charge at Sparsh Hospice since 2013, where she oversees and leads the nursing team, ensuring the delivery of high-quality palliative care to patients and their families. I now invite the moderator for this session is Dr. Lokalila ma'am, HOD, Professor in Repertory Department from Hamsa Homeopathic Medical College, Hospital and Research Center.
Good afternoon, everyone. So today we are discussing about nursing in palliative care. I think everyone knows about nurse. from birth to death, we compulsory, somewhere we have to meet a nurse, right? So, palliative nursing. So first we have to discuss about the regular nurse. What is the difference between regular nurse and palliative care nurse? We have seen in most of the hospitals, regular nurses, they are looking for comfort, curative treatment. Means they are providing the treatment as per the doctor advice, and then the patient will discharge at home. Then we'll follow. Coming to palliative care, we have to keep in mind that the patient is going to terminal illness. Means end of life, the patient is going to face life-threatening illnesses. So we have to as a nurse, we need basic nursing skills to deal with the patient, how to deal the patient, how to provide a treatment, how to provide a nursing procedures. So we have to aware of that thing, basic skills in nursing, and a required individualized care plan. Every patient has different symptoms, so we have to keep in mind the patient is going to most difficult time in their life. Work with the patients, not only for the patients, we have to work with the patient family and friends also. Then we have to reassess regularly changes occurs into the daily basis of the patient. And most palliative care patients, every day is a new day to add their lives. So we have to reassess their symptoms daily basis. If the morning patient having some symptom, by the evening one more symptom may add. So we have to reassess every day. And in this nursing role, what is the nursing role? Observe the patient, assessment of the patient's needs, and evaluation of the results of interventions, and regular reassessment of the situations, modification of the plans. So depending upon the patient's conditions, we have to change our nursing interventions. Sorry, some disturbance. So most of the palliative care departments, every daily basis we are seeing so many wounds for most of the cancer patients. So I am working with Sparsh Hospice, one of the palliative care center in Hyderabad. So so wound care anedi chala important in nursing. Mostly మనం ఎవ్రీడే డైలీ బేసిస్ మీద wound పేషెంట్స్ని చూస్తూ ఉంటాం. బక్కల్ మ్యూకోజా అనే కానీ, బ్రెస్ట్ క్యాన్సర్స్, ఎనీ క్యాన్సర్, మోస్ట్ ఆఫ్ ద wounds మాత్రం డెఫినెట్గా ఉంటూ ఉంటాయి. సో ఈ woundని మనం అబ్జర్వ్ చేసినట్టయితే wound అనగానే మనం ఏమనుకుంటామంటే ఏదో కట్, చిన్న ఇంజురీ అంటాం. కానీ ఇలాంటి డిఫికల్టీ woundsని ఎవ్రీ డే మనం పాలియేటివ్ కేర్ సెంటర్లో చూస్తుంటాము. ఇలాంటి వాటిని డీల్ చేయాలంటే స్పెషలైజ్డ్ స్కిల్స్ అవసరం. ఎందుకంటే వీటిని రెగ్యులర్ హాస్పిటల్స్లో వెళ్తే మోస్ట్ ఆఫ్ ద ఎండ్ ఆఫ్ లైఫ్ పేషెంట్స్ హాస్పిటల్స్లోకి వస్తుంటారు. ఈ పేషెంట్స్ ఏంటంటే రెగ్యులర్ హాస్పిటల్స్లో వీళ్ళకి ట్రీట్మెంట్ ఏం లేదు, మీరు ఇంటికి తీసుకెళ్ళిపోండి ఈ పేషెంట్స్ని, వీళ్ళని జాగ్రత్తగా ఇంటి దగ్గర చూసుకోండి అని పేషెంట్స్ని పంపిస్తారు. నియర్ బై హాస్పిటల్స్ హైదరాబాద్ సిటీ ఏరియాస్లో ఉంటే వాళ్ళని ఎలా చూసుకోవాలి, నియర్ బై ఏమేమి సెంటర్స్ ఉన్నాయి, ఆ పేషెంట్స్ని ఎట్లా డీల్ చేయాలనేది కొంచెం అవగాహన ఉంటుంది. బట్ రూరల్ ఏరియాకి వెళ్ళినా కానీ, లేదంటే వేరే పేషెంట్స్ తెలియని వాళ్ళే కానీ, ఇలాంటి ఈ పేషెంట్స్ని ఎలా డీల్ చేయాలి, ఇంటి దగ్గర ఎట్లా చూసుకోవాలనేది వాళ్ళకి most of the members కి అవగాహన ఉండదు. సో ఇన్ మై ఎక్స్పీరియన్స్ 32 years old female diagnosed with some CA, I didn't remember actually, 2014 or 15. సో 32 years హాస్పిటల్ నుండి వచ్చేసింది పేషెంట్కి. దాని తర్వాత వాళ్ళు రోజు క్లీన్ ఎలా చేయాలో వాళ్ళకి తెలియదు. దాని తర్వాత విపరీతమైన పురుగులు వచ్చేసినాయి. ఆ పేషెంట్ దగ్గరికి ఎవ్వరు వెళ్ళట్లేదు. ఈవెన్ పక్కల ఈవెన్ ఇంటికి కూడా చుట్టూ పక్కనున్న ఇంటికి కూడా ఆ స్మెల్ అంత విపరీతమైన ఫౌల్ స్పర్శల హాస్పైస్ అని ఒకటి ఉంది, మీరు వెళ్ళండి అని చెప్పి ఫస్ట్ మినిట్స్లోనైనా లాస్ట్ స్టేజెస్లోనైనా ఒక కంఫర్టబుల్గా పెయిన్ ఫ్రీ లైఫ్ తీసుకొని మనం వెళ్ళిపోయామనేది కూడా మోస్ట్ ఇంపార్టెంట్ ఇన్ అవర్ లైఫ్స్. మోస్ట్ ఆఫ్ ద పేషెంట్స్ అనుకుంటారు పాలియేటివ్ కేర్లో ఏముంది, దట్టు నర్సెస్ చేసేది ఏముంది అని. కానీ చాలా ఉంది నర్సెస్ చేసేది. ఒక నర్స్ తలుచుకుంటేనే పేషెంట్ని కంఫర్టబుల్గా టిల్ ద ఎండ్ వరకు కంఫర్టబుల్గా ఉంచగలదు. ప్రొసీజర్సే కానీ వాళ్ళు ఇచ్చే పెయిన్ మేనేజ్మెంట్ కానీ ఎవ్రీథింగ్ ఈజ్ అ మ్యాటర్ ఇన్ ద ఎండ్ ఆఫ్ లైఫ్. సో ఆ పేషెంట్కి లాస్ట్ మినిట్స్లో స్పర్శకు తీసుకొచ్చిన తర్వాత మొత్తం 2-3 days పట్టిందన్నమాట. మ్యాగోట్స్ వచ్చేసాయి ఫుల్గా. సో టర్పెంటైల్ అవన్నీ యూజ్ చేసి పెయిన్ మెడికేషన్స్ ఇచ్చేసి ఒక 3-4 days తర్వాత కానీ తను అంతా క్లియర్ అయ్యి కొంచెం పెయిన్ ఫ్రీ వచ్చేసి తను కొంచెం స్మైల్ ఇచ్చిందనమాట. తను మాట్లాడలేదు, ఎందుకంటే లాస్ట్ స్టేజ్లో ఉన్నారు, ఫుడ్ ఏం లేదు, తను మాట్లాడలేని సిచ్యువేషన్లో ఉన్నారు. కానీ లాస్ట్లో తన నొప్పి అంతా తగ్గి తన మొత్తం ఇంత మాస్ కట్ చేసేవాళ్ళం మేము ఎవ్రీ డే. సో అంతా తగ్గిపోయిన తర్వాత తన ఫ్యామిలీ అందరూ తన చుట్టూ వచ్చారు, ఒక చిన్న స్మైల్ ఇచ్చి తను చనిపోయింది. సో ఆ స్మైల్ అనేది ఆ లాస్ట్ స్టేజెస్లో వాళ్ళ ఫ్యామిలీ చుట్టూ ఉండి ఆ కంఫర్ట్గా చనిపోవడం అనేది ఎంత మ్యాటర్ అది. 32 years old, 2 kids, ఎంత సైకలాజికల్ స్ట్రెస్. సో ఇలాంటి వూండ్స్ అనేది మేము డైలీ చేసుకుంటూ చూస్తూ వాటిని క్లీన్ చేసుకుంటూ చూడండి. మనం చూసినట్టయితే క్లియర్గా ఆ పక్క వూండ్లో మొత్తం మ్యాగోట్స్తో నిండిపోయి ఉందన్నమాట ఆ వూండ్. సో దీస్ ఆర్ ద కామన్ సైట్స్ ఫర్ వూండ్స్. బ్రెస్ట్, హెడ్ అండ్ నెక్, బ్యాక్, దిస్ ఈస్ ద అబ్డామిన్, దట్ ఈస్ ద బ్రెస్ట్. అండ్ వి సీ దిస్ దాని నిండా బ్లాక్ మొత్తం మ్యాగోట్సే. రియల్ పిక్చర్స్ దీస్ ఆర్ in our hospice. This is the problems that they have: discharge, foul smell, pain, bleeding and maggots. So discharges వచ్చినప్పుడు బ్యాండేజెస్, గమ్జీ ప్యాడ్స్ అట్లాంటివి యూజ్ చేసేసి అది మెట్రోనిడజోల్ పౌడర్ యూజ్ చేసి క్లీన్ చేసి ప్యాక్ చేసేస్తాము. ఫౌల్ స్మెల్ కోసం కూడా మెట్రోనిడజోల్ పౌడర్, మెట్రోజోల్ టాబ్లెట్స్ క్రష్ చేసి పౌడర్ చేసి యూజ్ చేస్తాము. దెన్ ద పెయిన్. సో అది ఎవ్రీడే నీట్గా ఉంచకపోతే సేమ్ ఇష్యూస్, మ్యాగోట్స్ వస్తూ ఉంటాయి. సో అంత చిన్న పిల్లోడికి అన్ని బాడీ ఇమేజ్ చేంజెస్ వస్తుంటాయి, వాడికి ఫియర్, సోషల్ ఐసోలేషన్. ఇప్పుడు ఎవరైనా వూండ్స్తో ఉన్నవారు వాళ్ళు నలుగురిలోకి వెళ్ళడానికి చాలా షేమ్గా అంటే ఏదో తప్పు చేసినట్టు. వాళ్ళు ఏం తప్పు చేయరు, వాళ్ళకు వచ్చింది చాలా దుర్భరమైన పరిస్థితి యాక్చువల్గా చెప్పాలంటే. కానీ వాళ్ళు నలుగురిలో తిరగలేరు, వాళ్ళ ఫేస్ను వేరే వాళ్ళకి చూపించుకోవడానికి ఇష్టపడరు. ఆ ఫ్యామిలీని సోషల్గా కూడా ఐసోలేట్ చేసేస్తారనమాట. వాళ్ళ ఇంటికి ఎవరూ రాకుండా. కొన్ని సిచ్యువేషన్స్ ఇప్పుడు కొన్ని దగ్గర ఇలా జరుగుతున్నాయి. ఇప్పుడు కొంచెం అవేర్నెస్ వస్తుంది. బట్ మోస్ట్ ఆఫ్ ద ఇలాంటి సోషల్ ఇష్యూస్, సైకలాజికల్, ఫిజికల్ ఎన్నో ప్రాబ్లమ్స్ని ఇలాంటి పేషెంట్స్ ఫేస్ చేయాల్సి వస్తుంది. And colostomy, the stoma is created into the large intestine, whether ascending or transfer or descending anywhere, to divert the fecal matter. Urostomy, and that is a tracheostomy. Who needs ostomy? I think this everyone knows. Interstitial obstructions, cancer, some of the blockages into the bowel, injury or affecting.
8 minutes more.
8 minutes. Okay. So GI irritations, Crohn's disease, bladder cancers, any blockages into the urinary tract, or any poison. This is the 2-piece colostomy tube untundannamata. This is the colostomy bags, 2-piece pouching system. This is 1 piece. We don't have 1 piece actually right now. Of the stoma, we have to cut the colostomy bag. ఇలా వస్తుంది. సో ఇది ఆ సైజుని బట్టి మనం కట్ చేసుకోవాలన్నమాట. ఇది colostomy bag చేంజ్ చేసే ప్రొసీజర్. దెన్ colostomy కేర్, ఎవ్రీ 3/4 or half ఫుల్ అయిపోయిన తర్వాత colostomy బ్యాగ్ని ఎంటీ చేయాలి. సో దెన్ కొలాస్టమీ బ్యాగ్ చుట్టూ ఎక్స్కోరేషన్, స్కిన్ ఎక్స్కోరేషన్ వచ్చినప్పుడు ఇది కరియా పౌడర్ అంటారు దీన్ని. సో ఇది ఎగ్ వైట్లో మిక్స్ చేసేసి దాని మీద అప్లై చేసి ఒక 5 మినిట్స్ 10 మినిట్స్ తర్వాత దాన్ని కొంచెం డ్రై అయిన తర్వాత దెన్ కొలాస్టమీ ప్రొసీజర్ బ్యాగ్ అనేది అప్లై చేస్తాం. దీనివల్ల స్కిన్ ఎక్స్కోరేషన్ అనేది తగ్గిపోతుంది అన్నమాట, దీన్ని ఫ్రీక్వెంట్గా యూజ్ చేయడం వల్ల. సో డైట్ ఏంటంటే eat regularly, take plenty of water, avoid spicy foods and gas producing foods వీటన్నిటిని కూడా అవాయిడ్ చేయమని చెప్పాలి. అండ్ ట్రావెలింగ్కి వెళ్ళినప్పుడు కానీ వీటన్నిటిని కూడా సేఫ్ అండ్ సెక్యూర్గా ఎలా ఉంచుకోవాలి అనేది మనం వాళ్ళకి ఎక్స్ప్లెయిన్ చేయాలి. మోస్ట్ హై ఫైబర్ డైట్ ఇవన్నీ కూడా మనం వాళ్ళకి చేయాలన్నమాట. ఈ కొలాస్టమీ కేర్కి వచ్చేసి ఇంకొక ఎగ్జాంపుల్ ఏంటంటే 82 years ఓల్డ్ లేడీ సిఏ కోలాన్. సో ట్రీట్మెంట్ అంతా అయిపోయింది, తను కూడా సేమ్ హాస్పిటల్స్కి రెగ్యులర్గా వచ్చేసి 2 daysకి ఒకసారి 3 daysకి ఒకసారి వచ్చి కొలాస్టమీ బ్యాగ్ చేంజ్ చేయించుకుంటూ వెళ్తుందనమాట. సో వన్ డే ఏం జరిగిందంటే 2 days తర్వాత తన ఇంటికి వెళ్ళిపోయింది. తను ఫుడ్ తీసుకోవడానికి చాలా ఇబ్బంది పడుతూ ఉండేది, కానీ అలా ఉండి కూడా ఇంట్లో మొత్తం తనే ప్రైమరీ కేర్ గివర్. సో ఫ్యామిలీ అందరికీ కూడా తనే వంట చేసేసి తను ఆ నైట్ నుంచి ఇంట్లో ఎవరు ఫుడ్ తినట్లేదు. తను ఆ నైట్ మా ఎందుకు ఏడుస్తున్నావు ఇప్పుడు చేంజ్ వాళ్ళు ఫేస్ చేసుకో తను అన్నది మా హస్బెండ్ ఎందుకంటే ఇది కేరింగ్ వాళ్ళు నాకు ఇంట్లో నాకే ఫుడ్ ఇవ్వట్లేదు. తను వాళ్ళ హస్బెండ్ ఏం చేస్తారంటే ఏంటి అనేది వాళ్ళ హస్బెండ్ కూడా ఆమెని చూడట్లేదు, ఎందుకంటే ఉంది. బట్ ఎనీవే లాస్ట్ ఏంటి అనేది వాళ్ళ హస్బెండ్ కూడా ఆమెని చూడచ్చు డిఫికల్టీ టైం అను. సో థ్యాంక్ యూ ఫర్ గివింగ్ దిస్ ఆపర్చునిటీ.
థ్యాంక్ యూ మ్యామ్.
థ్యాంక్స్ అనుష గారు, చాలా ఇన్ఫర్మేషన్ ఇచ్చారు నర్సింగ్ కేర్ గురించి. Nurse role is very important for palliation, and she looks after all the needs, spiritual, as it is said before, spiritual needs, psychological, all needs are looked after very well. And Sparsh, as the name indicates, Sparsh is only adopted by the nurse. And thank you very much, Anusha.
I'll just take a minute. I'm sure all of you are homeopathic students. After 2 years or 3 years or 4 years, you are going to become doctors, thinking that why I should learn from anything from Anusha. She is after all a nurse. Believe me, to give a good palliative care, you don't have to be a doctor, you don't have to be a nurse, or you don't have to be a social worker. You should have a good heart to treat the patient. Today, let me ask our Basu, Mujib and Radhakshan. Radhakshan, you are here. Please stand up. They are not doctors, they are all volunteers. Basu, why I am telling this is, please understand, I was requesting with your chairman, please visit Sparsh Hospice, and there is a lot to learn. And I have visited around more than 30 countries, and every country I have visited all the hospice centers. That's how I could become a good palliative care physician. I'm telling you because, see, the moment you go to your place, where are you from? You are from which place, which part of Telangana? Hyderabad. Once you go back to your place, in your own street, there are at least one or other persons who need palliative care. Don't think that they should have cancer or any chronic diseases. If somebody is there outside, just go and talk to them. Just sit next to them, put your hand across them and talk to them. Just sit in the same level. That gives good palliative care. Of course, lack of time, we are not able to teach. I could observe, Dr. Anjaney, please stand up. Dr. Anjaneyulu is the senior consultant in Sparsh Hospice. The way he was taking that pouches, everything, not even attender will do it. Of course, all these things he has learned after he is becoming a palliative care physician, because there is no hierarchy. Everybody is equal in palliative care. Suppose you will think that, no, as a doctor, why I should take it? Because so there is no hierarchy. The moment you see any patient, even when coming out, I just asked him to wear, because he was HbA positive, he wore gloves and he just pressed it, had sent him with midazolam, subcutaneously he just gave, he had a peaceful death. That's what we want in every person. There is a Sparsh only in Hyderabad. In a city like, state like Telangana, where people have to travel 200 kilometers, 300 kilometers, when they don't have money just to reach their taluk headquarters, how can they reach capital city? So that is the reason each one of you, today after getting trained here, each one of you should go and talk to another 10 people, 10 minutes at least, about palliative care. For this doesn't cost money. Only thing is you should have a good heart that I should make a difference to the society. Thank you.
I request Dr. Lokalila ma'am to present the memento and certificate of appreciation to Srimati Anusha ma'am. A round of applause for them. I request Dr. Lagnajita ma'am to present the memento to Dr. Lokalila ma'am. I now hand over the mic to Dr. Pavani.
Good evening, one and all. Our next session is about sleep disorders. Sleep disorders are conditions that interfere with normal sleep patterns affecting overall health and quality of life. Addressing these disorders typically involves of medical evaluation and tailored treatments to restore restful sleep and improve daily functioning. I invite the speakers for this panel discussion. First, Dr. Abhijit Sai Shankar RS, Assistant Professor, Department of Homeopathic Medical Medica. Sir completed UG and PG from Sharada Krishna Homeopathic Medical College from Kulashekaram, Tamil Nadu in the year 2017 and 2020 respectively. And he also a topper in the MGR University in Medical Medica Department Part 1 exam. He came into palliative care since 2016 and did PG dissertation in palliative care and sleep medicine. He is currently working as assistant professor in Materia Medica since 2021 in Hamsa Homeopathy Medical College and Research Center. I also invite Dr. Anjaneyulu Konda to take the dais. Sir, please be seated, sir. Dr. K. Jayakrishna, sir. Please be seated, sir. Dr. Arul Amutan. Dr. Mallikarjun. And Dr. Saujanya. I invite the chairperson for this panel discussion, Dr. Nuru Seher Khan, Principal, Professor and HOD, Department of Psychiatry, PG Guide, Hamsa Homeopathy Medical College and Research Center, KNR University of Health Sciences, Senate member. I also invite the moderator for this session, Dr. Billa Gurunadam, Professor and HOD, Department of Psychology, Hamsa Homeopathy Medical College and Research Center. He is a HOD.
Okay, post-lunch session. So generally we will get the sleep. But we are discussing on the palliative care. Sleep disorders, what we are going to discuss about the sleep disorders. On this occasion, we invite first speaker, Dr. Abhijit Sai Shankar, RS.
Good afternoon to all present over here. Respected great minds of palliative care, respected great minds across system. Here is my humble presentation over to you. I think this presentation may evoke your mind to turn your specialization towards palliative care. So let's start with the case. So this is a case of Rajeshwari Amma. And conventional palliative care is when you are selecting a simillimum based on some symptoms, it does only a palliation for the patient. You will be noting the seventh observation of the kind, where only the neurons. So mirror neuron, who is helping you to sleep properly? What is the physiology of the sleep? So it's very simple. I'll tell you. So in this picture you can see that VLPO. So that's VS just adjacent to the hypothalamus and are basically liberating GABA. This GABA are nothing but neurotransmitter which is having an inhibitory action. And this inhibitory action, this GABA is now being secreted in your brain. And this GABA will be going to the other areas which will wake you. Okay, which will be going to LDI, LC, all this nucleus. It will go and it will block the other neurotransmitters. Then you will sleep. This is the actual sleeping method. And when there is a lesion in the level of VLPO and MNPO, there will be sleeplessness. Okay, what the allopathic medicines are doing? Barbiturates, most common are barbiturates, right? This barbiturates will be bounding to GABA A and GABA B receptors, and they will be producing this neuroinhibitory transmitters, and thus you will get the sleep. Homeopathically, what you can do in this stage? If a person is sleepless, can you identify this magical plant? You will be awarded if you are naming this plant. Come. Exactly, this is a family, and morphine is one of the using insomnia severity index. And there was a marked change in the sleep for patient who is in terminal care. Okay, not for a patient who is not having a sleep for 1 or 2 days. A terminal care who is not having sleep for so many days. It can be out of socio-economical cause, or it can be out of delirium. It can be out of pain of bed sores. It can be ill effect of chemotherapy. For all these conditions, this magical remedy was working. I given this remedy in tincture. 10 drops will help you to palliate the pain. 20 drops will help you to induce the sleep. Okay, that's the action of Excelsia. So not only insomnia, it's also very good remedy for pain. So that was compared with the help of visual analog scale, where there was marked change in the sleep pattern, pain pattern before and after Excelsia californica. Okay, so you will be wondering, only do we have 65% of the patients were cancer or with ill effects of cancer treatment. CVA was 25%, 7% is Parkinsonism, and other 3%. That one patient was with severe respiratory distress. Okay, analytical studies show the study H1 is positive, means my hypothesis 1 was good. And other sleepless remedies in homeopathy. One is, every one of you know about passiflora, right? But I have seen many people blaming passiflora, that maybe passiflora should be given in tincture form, that everyone is aware of that. But you will have a tendency to give only 10 or 15 drops of passiflora. Giving 15 drops of passiflora and blaming passiflora is not the pattern. Okay, you should give 2.5 ml of passiflora, means 50 drops of passiflora at a time if you have to give. Only then the sleep can be induced. Okay, other remedy is cypripedium. This is another remedy which induces sleep in tincture form. Pisidia is another magical remedy in tincture form which will induce sleep. Okay, Pisidia, the notations in Pisidia is right. The person took Pisidia and he fell into sleep immediately, and he woke after 12 hours, and he woke without pain. Oh, that is the notations written by Herring in Pisidia. Another drug is Scutularia, which is a very good nervous sedative as well as sleep-inducing remedy. Another sleep-inducing remedy is Lupulus humulus. Okay, another remedy is Daphne indica. Another remedy is Avena sativa. Avena sativa is a wonderful remedy to sleeplessness, for especially in case of alcoholics. This is also a wonderful remedy for people who is having neurasthenia, or if you are having a continuous mental stress throughout the day. In palliative care, you will be seeing patients with mental stress with many other background factors. You give Avena sativa, Avena can induce sleep for them. Avena is also a very good nerve stimulator, so that only not sleep, that also provides some kind of energy to the patient. Then Hyoscyaminum hydrobromatum is alkaloid of Hyoscyamus. This is also a wonderful remedy in tincture form. Note, in palliation, everything given in tincture form is, some people have a misconception that if we are using tincture, that's not homeopathic. Everything given in similia is homeopathic. Let it be tincture or let it be in potencies. Hope I am clear, right? So everything, especially in palliative care, the medicine should be in Avogadro number. Okay, it should be below 12x. Other remedies for sleeplessness include cannabis indica in tincture form, cocaine, the alkaloid of coca, coffea, codinium, again alkaloid of opium, very good. And one more remedy is Nux vomica, opium itself. Opium, either you should not give opium in tincture form. Okay, noted. Opium is an addiction causing agent. But same Escherichia californica belongs to same Papaveracea family, but you can use harmlessly. It's a harmless tincture, but opium is harmful tincture. That's where the importance of Escherichia comes. Opium and Escherichia will be having almost one and the similar alkaloids. Morphine is one of the major contents in that. Symbol is another remedy for sleeplessness, where extreme bony pain will be presented by the patient. So you cannot handle a sleepless case only with sleeplessness remedy. You should also give a specific, for example, most of the cases we will be having after cancer treatment or after radiotherapy, right? So I will give a light on cancer remedies also, specific cancer remedies, along with which this sleep remedies you have to use. Okay, that the cancer specific remedies include Calthapola, then Cinnamonium. These two remedies have to be given in uterine cancer. Next comes Asterias rubens. You will be aware about this mammary cancer in ulcerative stage. Then comes importance of conium maculatum. In cancerous diathesis people, conium maculatum should be given in higher potencies. Higher potencies in the sense, higher potency in the palliative care is maximum 30. Okay, lower potency in palliative care is below 12. Okay, especially in palliative care. Then Castoreum cana is a specific remedy for CA tongue. Tarasacum is a specific remedy for CA bladder. Okay, all other remedies should be given in tincture form. Another, acetic acid. Is, you know how acetic acid is presented with weakness, right? With epithelial cancer. In tincture form you have to administer. Both locally and internally. And Ruta. Ruta is wonderful remedy for carcinoma of lower bowels, as well as it's a magical remedy for what? Brain tumor, where research study shows that Ruta is capable of cutting off neovascularization. Okay, so one of the presentation of Ruta is in brain tumor stage. What will be the common presentation of Ruta in brain tumor? Sorry, not Ruta. Brain tumor presentation. A tumor. There is a substance, some substance is compressing there. So compressing symptoms will be there. The patient will be presenting with epilepsy, right? Epilepsy is one of the common symptoms. So there is a saying in Ayurveda, sir, with your permission, like Aruda. Aruda is common name of Ruta in Ayurveda. So Aruda veetil undengil avide avasmaram arudu. Means if Ruta is in your home premises, there won't be any epilepsy. So Ruta is also one of the major remedies for epilepsy, which we are missing. Okay, we should also make use of that. Then Lobelia. Lobelia is a very good remedy for CA omentum. Then Ornithogalum ambulatum is a magical remedy for CA Condurago tincture. Then Hydrastis canadensis tincture is a wonderful remedy where principal symptom should be pain before ulcerative stage. In ulcerative stage, other remedies will be indicated. Sir, just a minute. Euphorbinum officinalis. It's a remedy for terrible burning pains of cancer. Then other pain useful remedies in cancer include acid phos, calcarea oxalata, Soralia tincture, macphosin lower potency, symphytum tincture, and Stachys officinalis tincture. Cadmium sulf, natrum, cacodylicium, and Susurrus lapa. Above all this remedy, Carbo animalis starts at the top. Carbo animalis stands in head of all this list, head of remedies for palliative care, where malignant infiltration and indurations are predominant, and the patient is not acting to any other remedy. Okay. So some remedy for bad effects of chemotherapy include Occubeba obreveli. Okay, Occubeka tincture should be used for the bad effects of chemotherapy. Then for the bad effects of radiotherapy, X-ray and radium bromide should be used. Okay. And Indian government has initiated few plans for palliative care. National Palliative Program for Palliative Care and Indian Association of Palliative Care. I don't know how active these groups are. Research evidences for palliative care. So not only clinically, you can also involve yourself into palliative care in research field also. Okay. So palliative care is a undiscovered mine for you people. Maybe if you are working properly in palliative care, maybe you can write your name after a Nobel Prize. Okay. So coming back to our case, how can we give treatment for our Rajeshwari Amma? So with integration of everything all around us. So the bed sores, homeopathically how can we treat this bed sores? With the help of calendula. Calendula is a very good remedy that can that will help to heal the bed sores, right? After bed sores, what will be the complication? The patient is unable to move. The patient may urinate in the bed itself, right? I have seen many patients who is not taken. If I am telling those stories now, I need more 48 hours to expand that. So I am not going into that. So catheter care should be given as demonstrated by our nurse ma'am. Nursing care is very important. Nursing care is oxygen of palliative care. Then physiotherapy should be given. It should be it should be in an integrated form, right? Physiotherapy should be given to the patient. so that her range of movements will be preserved. And very importantly, a counseling psychologist should be there to counsel the patient and the patient's family, so that they will be mentally stable. If they are not mentally stable, if you give whatever the best remedy available in the earth, it will not work. But if the patient is mentally stable, you give a cup of water, the patient will perceive that as a medicine. Okay. So with all these measures, Rajeshwari Amma was given a quality hospice care homeopathically, and her last words were, "Give me that homeo medicine." Few minutes after which she took her last breath very peacefully, and she died in 2019 December. For 11 months I was able to give her a complete care, where after chemotherapy she was given only a lifespan of 30 days. She was able to live for 11 more months after chemotherapy with homeo medicines and integration of other systems. You know who is he? He is M.R. Rajagopal, father of palliative care of India. So I dedicate this presentation to M.R. Rajagopal, and that's all about my presentation. Hope you got something from my presentation. Thank you.
Thank you very much, Abhijit. He not only explained about the sleep disorders, he was given the therapeutics of the cancers. So very good lecture. Thank you very much. The next speaker is Dr. Anjaneyulu Konda.
Good evening. So, Dr. Abhijit covered many of things. I don't want to repeat them. So, before, going from this place, we have to understand one thing. As doctors or medical students, we have to learn this, make it a habit. So, we know the 4 vital signs regularly we check at the patient bedside. What are those? One is BP, next one is temperature, third is pulse rate, fourth one is respiratory rate. Pain is the 5th vital sign. ఎప్పుడైనా మీరు బెడ్ సైడ్ వెళ్ళినప్పుడు ఒక పేషెంట్ దగ్గర మీకు పెయిన్ గురించి ఎంక్వైరీ చేయకపోతే యు ఆర్ నాట్ ఏ గుడ్ డాక్టర్. సో 5th వైటల్ సైన్ ఈస్ ద పెయిన్. ఖచ్చితంగా అడిగి తీరాలి. బీపీ, పల్స్, రెస్పిరేటరీ ఎట్లా అడిగారో 5th పెయిన్ అడగాలి. వాట్ ఈస్ ద 6th వైటల్ సైన్? స్లీప్. గుడ్. గివ్ ఏ గుడ్ రౌండ్ ఆఫ్ అప్లాస్ టు దట్ పర్సన్. ఎస్, స్లీప్. స్లీప్ ఈస్ ద 6th వైటల్ సైన్. ఎవరినైనా మీరు బెడ్ సైడ్ వెళ్ళినప్పుడు యూ విల్ గెట్ గుడ్ అప్లాస్ ఫ్రమ్ యువర్ పేషెంట్. ఈస్ ద స్లీప్. యూ హ్యావ్ టు ఆస్క్. సో రిమెంబర్ దిస్, అండ్ ఎవ్రీ టైమ్ యూ హ్యావ్ టు మెజర్ దట్. అండ్ వెదర్ యూ హ్యావ్ స్పెంట్ క్వాలిటీ ఆఫ్ స్లీప్ ఆర్ నాట్. పొరబడేది స్లీప్, కానీ ఎవరు అడ్రస్ చేయరు దాన్ని. స్లీప్ ఏముందిలే, ఫస్ట్ నొప్పి చూద్దాం, ఇంక వేరే అవస్థలు చూద్దాం. స్లీప్ గురించి ఎవ్వరు పట్టించుకోరు. రెండు ముఖ్యమైన విషయాలు మనం అడ్రస్ చేయాలి. ఒకటి రాత్రి నిద్ర, డే కంఫర్ట్. ఈ 2 మనం పేషెంట్కి ఇచ్చామంటే గుడ్ స్లీప్ హైజీన్ ఉండదు. ఎందుకంటే వాళ్ళకు ఉన్నటువంటి అండర్లైన్ ప్రాబ్లమ్స్ వల్ల మేబీ పెయిన్ అయి ఉండొచ్చు, లేదంటే డిప్రెషన్ అయి ఉండొచ్చు, యాంగ్జైటీస్ ఉండొచ్చు, ఫియర్స్ అయి ఉండొచ్చు. నాకు తెలియదేమో చనిపోయేటప్పుడు. అలానే చనిపోతానేమన్నాడు కానీ అటెండర్ పడుకోవట్లేదు, ఫ్యామిలీ మెంబర్ పడుకోవట్లేదు. సో దానివల్ల ఏమవుతుంది, ఇరిటబిలిటీ వచ్చేస్తుంది. అసలు రాత్రంతా పడుకోడు, ఏడుస్తూ ఉండి అటెండర్ని ట్రీట్ చేయండి. ఏం చేయగలుగుతాం? అటెండర్ని ట్రీట్ చేయాలంటే మనం ఏం చేయలేం. అటెండర్కి ఒకలాంటి రిలాక్సేషన్ కానీ, ఒక కంఫర్ట్ కానీ, ఒకలాంటి రెస్పెక్ట్ కావాలి. అటెండర్ని మార్చాలి. అంటే మనము అమ్మ కేర్ తీసుకుంటే దాని బదులు అక్క కేర్ తీసుకోవడం, లేదంటే తమ్ముడికి.
Thank you very much. The beauty of Ayurveda is it doesn't explain anything in pages together. It will give you one simple clue. So if there are 3 వాతదోషంని తగ్గించే ఏ మెడిసిన్స్ మీ దగ్గర ఉన్నాయో మీరు యూజ్ చేసుకోవచ్చు. అది తలకి అప్లై చేస్తారో, కాళ్ళకి అప్లై చేస్తారో, ఒళ్ళంతా ధార చేస్తారో, శిరోధార చేస్తారో, ఇట్ ఈస్ లెఫ్ట్ యూ. So what we do, so to bring down the vata dosha, we can use shirodhara. Shirodhara is use of a medicated oil like Taila or Himasagar Taila. There are three major Tailas. These are used to, as we just try to continuously pour it over the forehead. With the lying down position, one person will be staying on the back side and he or she will be continuously massaging the scalp, and the pouring will be to the forehead using a cotton cotton thread like thing. There will be a pot hanging over the head of the patient, and it's a half an hour procedure. So usually what happens is, because this is the area where the pranavayu is getting aggravated and which is going to disturb your sleep, what do you call the brain related position of where sleep is induced. So this is how Ayurveda treats. This is the main treatment which is followed in our clinical care. Second thing is, if it is a home-based care, what we can do is Padabhyangam. Padabhyangam means you take a little bit of these medicated oils or plain til oil, ginger, do the massage. This also will induce. Each day and the night are divided into three parts. Two is the Pitta period. If the patient is sweet taste, sour taste, salt taste, or natural increase of Vata dosha is happening, so we select those medicines like Drakshadi Kashayam. Then we have Kshirabala 101 Avarti, Dhanvantaram 101 Avarti, Manasamitra Vatakam. These are some of the very commonly used medicines in Ayurveda to induce sleep. I think this is what I had to share. Thank you.
Thank you, Mirochi Dr. Jayakrishna Garu. We explained about the Vata, Pitta, Kapha, that is role of sleep and some of the medicines that are acting on the sleep. Thank you very much. The next speaker is Dr. Arul Amutan.
Please, can you project the PowerPoint? So very good afternoon. So like Ayurvedic system, we check the pulse, and if there is a Vada is high, then the system oil is actually for the internal administration. Transdermal drug delivery system is achieved by oil, hair oil. So selectively use the oil like Sandhanadi Tailam, Tirifala Tailam, or lotus based oil. So how much Pitta is? As a home remedy, we advise our patients 5 gram or 1 spoon they have to mix with the water or milk and to be boiled for 10 minutes, and they have to consume the whole. That day they will get a very nice sleep. It has to be done at night time so that the nervous system gets calmed down and they can sleep better. Second thing, Jada Mansil. So this is another herbal root, plant root that powder milk in the forehead. So again, here we apply the Verma therapy because here the Bala Verma is there. So when the kids are actually crying, then you can do gentle massage on the forehead. They will be calmed down. Or you see in your home you may have pet animals, dog or cats. So you do massage on the forehead. They will immediately sleep or calm down. It is because the Bala Verma here that points is having that therapeutic potential. So that can be stimulated by hand, or you can apply. So again I told we can manipulate or control internal organs through external points. So by that we can do the Verma head massage. Drug would be delivered into the drugs will be absorbed into the bloodstream. After that they have to take a bath. They have to take a shower in a warm water. That day sleep is guaranteed. So this is how weekly once we can advise. Then weekly one whole body oil bath. So especially if the climate is winter season, then we have to ask them to use the mustard oil. If the climate is very hot, then they have to use the sesame oil. Head to bath, head to the toe, they have to just apply the oil themselves and wait for 3 hours. 11 o'clock if they apply, 2 o'clock, or 2 o'clock if they apply, 5 o'clock, they have to wait. They can do other activities. Then you take a shower in a warm water, you will get a nice sleep. So these are the simple things we can integrate for the insomnia from our practice. This morning I showed how the Verma therapy works. So this is another example. Even though many organs are simple like umbilicus, it has still connection with the bladder and other organs because it served an important connection between mother and child. But after we delivered, the umbilicus has no value, but internally still it has a network with many organs. So this is how it is one of the important Verma point. So there are 12 nadis. Each nadi will start from one point and it will have its own, like a river or a road pathway. It will have its own pathway and it will end in one orifice. So we learned we have 9 openings, but actually we have 12 openings. So it will start, for example, Idagala. It starts from the right big toe and it will pass, it will link so many parts. Finally, it will end to the left nostril, Idagala. This is how along the channel, the Verma points are there, how the bus station is there in the roadway, like that. So each channel, it has to be run in a proper way. There is a cycle, biological cycle for each nadi and all. So if you get any trauma or if you manipulate these individual points, you can use some beneficial effect. That is what Verma therapy. There are 1008 points are there in the human body. So all the 1008 points will be having some therapeutic potential, and how to manipulate is the Verma therapy. So you can manipulate using the hands and fingers. There are specific pressure to be applied. You cannot simply manipulate. So each point has to be manipulated with a specific pressure to get the effect. So this is like a chiropractic practice. So along with the pressure, some manipulation technique is involved. So lumbar disc herniation, so many diseases you can easily handle with that. This is the Varmasanam. Patient is not able to do asanam, but we can do on behalf of them along with the Verma manipulation. So we are doing this all in Manipal and we are giving training to our students. So you look at this is the Rangoli. Different dots are there connecting. The dots is called a Rangoli. Verma therapy is like that. There are different Verma points. You connect, that is called a Verma massage. So Verma massage is not the spa massage, not the relaxing massage. It is a therapeutic massage. So there are different specific pattern is there. Pattern is there connecting different dots. So we have protocols for frozen shoulder, for headache, insomnia, migraine, sinusitis, different diseases. We have different protocols. So this is taught to our students. Even Mokshbisham or Agni Karma in Ayurveda, we say Suttigai. Those Verma points can be manipulated or stimulated by heat therapy. Same point. Again, cupping, Unani, it is extensively used. In Siddha, we are manipulating the Verma point by different kind of stimulation. So this is how Verma therapy can be like after the yoga. Verma therapy is the one India is going to donate to the world. I am sure it is a non-pharmacological approach. So this therapy is available open for all. Even we have students from medicine background, AYUSH background, people are there from international level. So first time we are teaching this to AYUSH doctors, so you can come and learn and you can start your practice. Thank you so much.
Thank you, Dr. Arul Amruta. Actually, Siddha is the first time what we are seeing. Previously, we didn't see about the Siddha. Only we are seeing in the AYUSH department as a Siddha. First time we are seeing your presentation, the Verma points and application of oils for making of sleep. Okay, thank you very much. So next speaker, Dr. Mallikarjun, Naturopathy.
Good evening, everyone. We all know the different sleep disorders. We have sleep apnea, we have snoring, we have narcolepsy, we have sleep paralysis, so we have sleep talking, right? Then rest leg syndrome, so exploding head syndrome. All these patterns are the sleeping disorders. In yoga, there is a beautiful explanation regarding how disease is caused. Because I'm from yoga therapy background, I would like to emphasize this point. We have the Panchakosha theory. Many of my naturopathy students will be knowing it, and the specialists on the dais who are from the yoga background will definitely know. We have the 5 koshas, Annamaya kosha, Pranamaya kosha, Manomaya kosha, Vijnanamaya kosha, Anandamaya kosha. So beautifully it has been depicted in yoga that any disorder starts from the Manomaya kosha. That is the stress factor, the anxiety, stress, right? So from that, the manifestation will come to Annamaya kosha, and the disease manifestation occurs. Even the cancer also is like that only. As per the yoga, it says that we have psychic phase, we have psychosomatic phase, we have somatic phase, and organic phase. So every disorder starts with stress, anxiety, insomnia, and once the disorder manifestations like cancer or any kind of autoimmune disorders, we are attributing to stress now. So again there will be pain and there will be insomnia. మనకు ఒక సామెత భూమి గుండ్రంగా ఉంటుంది అని. ఇన్సామ్నియాతో స్టార్ట్ అయ్యి మళ్ళీ ఇన్సామ్నియాతో వస్తుంది. సో మనకేంటంటే పాలియేటివ్ కేర్లో మనం ఎక్కువ ఎంఫసిస్ ఏం చేస్తాము అంటే వాళ్ళకి నొప్పి తగ్గించడానికి we want to reduce the pain, right? We want to increase the quality of life. We want to actually induce sleep in them. But the root cause of that disorder itself is insomnia. So it looks that is what we call it palliative care, because many of the cases which we admit our Naturopathy hospital are the chronic disorders, chronic ailment, as they will be suffering from 10 to 15 years. So first 3 days are very crucial. Once they get admitted, they will not have sleep, they will have nausea, they will have vomiting sensation, they have dyspnea. So all these things will be attending at the night treatments as per the symptom. So 90% of the cases, once they are admitted, they will have these kind of symptoms which we have to attend. For that we have number of remedies, like we have one powerful remedy we call it hot foot bath. Many might have been using it without knowing that it is an excellent therapy. Like we can put our feet in hot water before going to bed. That will induce very good sleep. And one of our speakers was telling we should go for a little bit of foot massage, which releases, okay, stress. So, and not only that, yoga therapy, like relaxation techniques. If we induce relaxation techniques, as one of the speakers was saying, some people are afraid of sleeping because they may not get up in the morning. They don't know. They may die in sleep. So this kind of anxiety situations will be there, which we have to release. And yoga plays a very vital role. We have very beautiful relaxation techniques, we call it, which usually we can teach at the fag end of the day, or even during the office time also. The people who are having stress, they can follow it. And we have deep relaxation techniques, which are called part by part relaxation, or yoga nidra we call it. So these are the techniques. As in morning also I have shared with you, in terminal cases of cancer also, once we have imparted this yoga nidra and assessed their quality of life with the questionnaires, they had very good improvement. One example I would like to take 1 minute. They are going to death. They have cases, the cancerous cases, there is a regression of cancer also. So one example is my father who was diagnosed with gallbladder carcinoma at the age of 72. Now he is 87. He has not taken a chemo cycle, he has not taken a radio cycle. He has just taken the naturopathy and Ayurvedic medicines, holistic approach. Because my sister is a doctor, Ayurvedic doctor. So he told me on that day, I don't want any kind of therapies. You learn the techniques, you practice on me. I am going to be a subject. Then we have, after 1 year, when we went for the CT scan, the radiologist was surprised. He was asking, is it the same person who has come? Is the name misdiagnosed? No, sir. We have gone for 4 kinds of investigations, and it was marked as cancer. After let us go and have a check. He said, when I'm all right, why should we go for the check? So we have shown regression. An nasopharyngeal carcinoma, a young boy of 17 years, where the children, the parents have abandoned the child in our hospital. They admitted and they absconded. And we don't know what to do.
The importance of the sleep.
స్లీప్ అనేది ఆల్మోస్ట్ అందరిలో వన్ టైప్ ఆఫ్ డిసార్డర్గా అయిపోయింది. ప్రతి ఒక్కరికి ఉండే స్లీప్లెస్ అనేది ఇప్పుడు నా డేస్ అందరికీ ఉంది. యునానీ ట్రీట్మెంట్లో హెర్బల్ బాతింగ్ ఉంటుంది అండ్ మసాజెస్ ఇస్ వెరీ ఇంపార్టెంట్. రోగనే కష్కష్ అండ్ మాజునే ఫలాసఫా, ఇది మస్ట్. స్లీప్లెస్ డిసార్డర్స్ ఉన్న వాళ్ళకి ఇది చాలా బాగా వర్కౌట్ అవుతుంది. ఇట్స్ ఎనఫ్. Thank you. Thank you all.
Thank you, Dr. Saujanya garu. Explain about the methods in the Unani medicine for getting of sleep.
Sir, I request the chairperson to speak something.
So, the importance of the sleep. Sleep is one of the physiological phenomena. Sleep can give the rest to the physical body as well as mental body. So, whatever the ailment that occurs, mainly the sleep is one of the important factor. So, during the palliation care, so we can make it induce the sleep also along with other treatments like that of holistic approach, what we can do. So, in this way, we can also give treatment to the sleeping disorders. Thank you very much for giving us this workshop on sleep disorders.
Very good afternoon. I think so audience are getting the valuable knowledge. I am really very, very privileged and very, very happy by the initiative taken by the NAPCAM and the team they are working. And they have brought the integrative system, various medicines on a single platform. If we work on a single platform, it will be very curable for the palliative, because we have from the morning session we have people reporting, because psychology and complementary and alternative therapies, by combining evidence-based treatment and holistic approaches, we can offer in more comprehensive and personalized care experience. This program aims to explore the intersection of palliative care and integrated medicine. We have discussed the benefits of the incorporating complementary therapies into palliative care such as pH management, emotional support, spiritual well-being, offering spiritual guidance and support to the spiritual needs. By understanding the potential benefits, I would like to extend my sincere gratitude to all the speakers, the panelists, the participants who have joined us today. Your contribution will undoubtedly enrich understanding of palliative care and integrated medicines. And one more request, I am very, very thankful to Dr. Abhijit, our faculty, who has taken a very good initiative, and our director, Dr. Imesh sir. And I request sir to please, we have to start one naturopathy unit in our college. Thank you so much.
Thank you, ma'am. I request Nuru Seher, ma'am, Billa Gurunadam, sir, and Abhijit, sir, to be placed on the dais. I request Dr. Billa Gurunadam, sir, to present the memento and certificate of appreciation to Dr. Abhijit Sai Shankar RS.
Give a round of applause.
I request Dr. Padmaja ma'am to present the memento and certificate of appreciation to Dr. Nurus ma'am. And also give a round of applause. I request Dr. Padmaja ma'am to present the memento and certificate of appreciation to Dr. Billa Gurunadam sir. Thank you, ma'am. I hand over this mic to Dr. Devika for next session.
So our next session is about mesmerism, polarity, techniques for palliation. Mesmerism is a historical concept of using animal magnetism to influence health. It was developed by Franz Mesmer in the 18th century. It suggests that a universal fluid influences health and could be controlled through magnetic or suggestive methods. I invite the moderator for the session, Dr. Shwetal Ma'am, Assistant Professor, Department of Practice of Medicine and PhD Scholar, Hamsa Homeopathy Medical College, Hospital and Research Center, to give the introduction about the speaker.
Good evening, everyone. I take the privilege to invite the speaker of the day, Dr. Ajaya Aipura. She is a homeopath by profession, trainer at Heartfulness Institute, past life regression therapist, Brighter Minds facilitator, diploma in yoga. She is currently pursuing her PG in the Department of Psychiatry in Jim's Homeopathy College.
A very warm good evening to all the dignitaries, dear doctors and all the delegates who are attending this session. First of all, I would like to thank Hamsa Homeopathic Medical College for inviting me for this presentation, and Jim's Homeopathy Medical College for giving me permission to be part of this seminar, and definitely Heartfulness Institute. As a team we have come, I have not come alone. We have 5 people who have come for presenting this heartfulness polarity, which is connected to mesmerism. So I would like to start with my presentation. And I know I won't take much time of yours, it's getting really late. Can we start the presentation? I have Ekta Madam, Sister Kripa, who is the trainer of Heartfulness Polarity. We have Dr. Vijay, whom you will all be familiar. He is also a Heartfulness Polarity trainer. We have Mr. Hardik. Many of you have heard about mesmerism. I know it's not a new word for many. So mesmerism, polarity technique for palliation. As we have already discussed about the in which he has mentioned, for instance, even in the last stage of death, which we have already seen in many cases, even in the last stage of death, to reduce that tension of the anxiety which is connected with it, this mesmerism really helps. Death seems approaching, or it is useful by distributing the vital force, the pranamaya kosha, which was already mentioned by Sir, uniformly throughout the organism when it is abnormal excess in one part and deficient in other parts. The restoration of the vital force to some one weakened part to the whole organism. So the mesmerism, the idea behind mesmerism is to transmit or to equally distribute the vital force across the whole organism. And the effect of communicated human power upon whole human organism was most brilliantly shown in the resuscitation of persons who laid some time apparently dead by the most powerful sympathetic will of a man in full rigor of vital force, and of this kind of resuscitation, history records undeniable examples. So the therapy, which is like a mesmerism, restores this energy flow. We have an interesting experiment by Dr. Emoto. If it is a water experiment, the influence of human body and what negative thoughts distorts the energy. You can see as a water as a property. That is, as you can see in the picture, the upper part of the body is the north pole and the lower part is the south pole. And what happens? This energy field, along supported by our internal vital force, forms a sheath which is known as pranamaya kosha, which was already discussed in the previous session, how the distortion in the pranamaya kosha disturbs the sleep, and in the end stage of life, how much that is disturbed, and sheath provides energy to heartfulness polarity, and which mental and physical condition as an add-on therapy. So the polarity sequences, before winding up the session, I would all of you just to rub your hands. just to see what is your energy level right now. Rub your hands very nicely and feel the field of energy between your hands. Can you feel a field of energy as you are trying to attract it and repel it? This is the energy field as a giver we are using. And the giver is connected to the heart and using this energy to balance the energy of the person who is receiving it. So there are 3 steps: charge, and we'll be giving suggestion, and discharge. Once the session is done, we'll be discharging it. In detail, we'll be telling later. And the do's and don'ts, who can take the therapy and who cannot. Do's is, we have to, who is giving the session should be stay connected, have a positive attitude, and male to male and female to female strictly, because both male and female energies are different. And drink water and wash hands. No body touching. As our Master Hanuman has already said, we are not touching. We'll be keeping the hand little away from the human body without touch to feel the energy field. And during pregnancy, it is avoided. And when we ourselves are in low energy level, we are not supposed to give this therapy. So I'm quickly going to show the few steps connected with this. These are the pictures which is represented how this therapy is done. There are sitting exercises are 3 and lying down exercises will be shown. These are the few exercises which is done. A lot of blockages. So once, and last picture, how this energy distortions got cleared and how the equanimity of this whole energy field is corrected. And the energy has increased to 58 joules. And the second diagram is the diagrammatic representation of the energy fields. For detailed description, we can call our Ekta madam. She has done this therapy and she has taken this in BioWell. Ma'am, I will invite you to have a brief description about it.
Lab by Dr. Konstantin Korotkov. In Russia, he's a quantum physicist who works in the St. Petersburg University. This has been going on given polarity. We've been doing this rather systematically to see what happens. And you can see that every organ is represented in the device which analyzes the person's energy field. And as you see that the patient has, for example, an energy reserve of 79% before the polarity treatment. And you see the several, like for example, on the right side, you see the cerebral zone. Can you go back? The right side, the cerebral zone is at a very low energy. If you look at the dip in the energy, you know, the little V which is down. And then after polarity, you see the increase in her energy levels. Already the energy reserve is at 100%. You see that the difference we have been, all of you spoke about it. You talked about empathy. I've been listening to you all and you know, what you spoke about as empathy is now measurable. Right? And that is where we can see that these are not just words. What Sir talked about, his nephew, it's not just words. It is actual physical effect. And if we are able to integrate such things within the premise of our increased, etc., you can we do this quite often. We take a person, put them through the thing, and then show you how it works and what goes on during polarity treatment. So, thank you so much.
Thank you so much, ma'am. So I think this is very interesting thing, this BioWell, where we can actually measure, not even simply telling by the experiences of a person who has undergone this therapy. So there we go. And yeah, important note is that polarity is not a substitute for any medicine, but we would need proper registrations, and it will be a proper workshop where this will be taught with nominal amount which will be taken. So thank you so much. Those who are interested, please come forward. You can connect with the coordinators. We'll be very happy to take this forward and give this as a learning tool for all of you to take it forward in your individual practices. Thank you so much.
Thank you, Dr. Ajaya. I know as students we all tend to give importance to aphorism number 1, 9, 26 and maybe 4 and 2. But here Doctor talks about aphorism number 293 and 294, which had so much of importance. I myself realized it today after seeing your presentation. So thank you for the insightful presentation.
I request Dr. Shwetal ma'am to present the memento of appreciation to Dr. Ajaya.
I request a Heartfulness Polarity team to come over the stage and receive our token of gratitude. Dr. Vijay Raghavan, Mr. Hardik, Mrs. Kripa. Ma'am, please felicitate. Vijay Raghavan.
I thank of Hamsa Homeopathy Medical College. Please come, please come. So it was just a, like introduction part which has happened today. Please come. And from our institution, we are hoping to work something soon in the future. We'll connect how we can support each other, as like we will be integrating with all the other systems also. We have speakers from all the other systems of AYUSH and modern medicine also. So let's join hands, taking this opportunity and make a way better, like to make things clear wherever there are obstacles, and where we have to the best option, and let's see why things don't work. Thank you.
I request Umesh sir to felicitate Miss Ekta ma'am. She is co-founder of Revolutionary Healing Method, Quantum Revolution, and she is also a Heartfulness Polarity trainer. Thank you, ma'am. I request Umesh sir to felicitate other Heartfulness trainers. Mr. Hardik, Dr. Vijay Raghavan, Miss Kala, Miss Kripa.
I request Dr. Umesh sir to present the memento to our moderator, Dr. Shwetal ma'am. Sports and Cultural Coordinator, Homeopathic Medical College, Hospital and Research Center.
Very good evening. Next slide. The state of Kerala, the debris coming out of its own ash. The alone surrounded of survival. Team members. He is someone to help us. That is his thinking, and the family members. Yes, the community is there to help him. Next slide. It can otherwise be termed as a social security investment, an investment for the self and others in the community around. The local population is coming forward to help each other in times of crisis. Next one. So this is the theory behind the community participation. People who can spare at least 2 hours per week to care for the sick in their locality are enrolled to undergo this training program. I was also caught hold of by this fascination. So I was told in the beginning, way back in 1997, that you can spend at least 2 hours a week. So I thought nothing, you see, it's a small thing. So I took myself into this new area of service. On successful completion of this training, volunteers are encouraged to form groups of 10 to 15 people and identify the problems of such people who require palliative care intervention. These groups are to be supported by doctors and nurses in the local palliative care centers. Next slide. They make regular home visits to follow up the patients seen by the palliative care team, identify and address their psychosocial and financial problems, organize programs to create awareness in the community, raise funds for palliative care activities including rehabilitation projects. They function as an effective link between the community and the palliative care providers. So this is a new method by which the state of Kerala, we have nearly 900, more than 900 palliative care centers, most of them driven by volunteers. NNPC is an attempt to develop a sustainable community-led service capable of offering comprehensive long-term care and palliative care to the needy. NNPC aims at empowering local communities, look after the chronically ill and dying patients in that community. Next slide. So these are the points which I wanted to share with you because it is too late. I have a request and an invitation. That is a second business for me. So this is regarding the next international conference of NAPCAM to be hosted in Belagavi. It is hosted by the NAPCAM Belagavi City Chapter in association with KLE Academy of Higher Education and Research, Kahar Belagavi. Next slide, please. We have a pre-conference workshop on 21st November, followed by a conference for 2 days on 22nd and 23rd November. Next slide. The theme of the conference is palliative care interventions promoting integration. That's why we organized a national workshop of this nature. This is the third of its kind across the country during this year itself. So this is the flyer of the conference. Next slide, please. Next slide. So this is what I would like to share with you. I invite you all. I know this is too late for a massive presentation. So thank you very much for organizing such a program in association with this college and NAPCAM Telangana State Chapter. Thank you very much. Thank you.
Sir, thank you so much, sir. This is truly educative and informative. Really, community participation in palliative. Sometimes we may not meet the actual real demand of the patients. So government should take more measures and initiatives so that because it could reduce the on-bed ratio as well as the financial burden during their terminal illnesses. Thank you so much, sir.
Thank you very much.
I request Dr. P.V. Sai Santosh Kiran sir to present a memento and an appreciation of certificate to our speaker, Mr. Radhakrishnan Menon. A round of applause for the sir. I request Dr. Katti Srinivas Babu sir to present a memento to our moderator, Dr. P.V. Sai Santosh Kiran sir. A round of applause for sir. We also like to give a token of gratitude to Dr. Pravas Pal, Medical Superintendent of JIMS Hospital by Umesh Akladevi sir. And Padmaja ma'am. A token of gratitude to Dr. Vijay Kumar, who is a Unani practitioner. We also like to give a token of gratitude to a napkin volunteer, Mr. Mujib. I request Dr. Durekula Mastanwali, PG Coordinator, Assistant Professor, Department of Community Medicine, Hamsa Homeopathic Medical College, Hospital and Research Center to come on the stage for the vote of thanks.
Good evening, everyone. They say good things must come to an end. But no one ever said we can't thank everyone before we leave. As we come to show, and we are truly grateful for the valuable information and perspectives you have imparted today. And I would also like to extend a special thanks to our respected college and leadership have been fundamental in making this workshop a reality. Thank you for believing in this initiative and providing us with all the resources and encouragement needed to bring it to fruition. Your dedication to our institution's mission and values inspires us all. I would like to thank our organizing committee and all the volunteers who have worked tirelessly behind the scenes to ensure this workshop runs smoothly. Your dedication and hard work have not gone unnoticed, and this event would have not been possible without your unwavering commitment. And lastly, to our participants, thank you for enthusiastic engagement. Finally, I would like to thank each and every one of you for being here today. Your presence and participation have been invaluable, and we hope that you found this workshop both informative. Once again, thank you for all making this workshop a memorable and fruitful experience. Have a wonderful evening ahead. Thank you.
Thank you, sir. I request everyone to stand up for national anthem.
जनगण मन अधिनायक